Good evening, everybody, and welcome to our March Children's Education, Housing Overview and Scrutiny meeting. Can I ask you, James, to tell us if we have any apologies? Thank you.
Yes, through you, Chair, we have apologies for non-attendance from Councillor Scott Packer, with Councillor Deborah King substituting for him.
Thank you. And we move on to any declarations of interest from any of the members of the committee, please. No? Okay, we move on to item number 3, which is the minutes. Can I ask all the committee members if the minutes are correct? Yes? Thank you. In that case, I'll sign them.
Okay, and I can find them. So there we are, please, Chair. Thank you.
Right, item 4, my announcements. Please could I just remind everybody to switch their phones to silence or switch them off, please. Secondly, we are being live webcam cast, so could I ask everybody that is going to participate in the meeting tonight to speak into your microphone and to speak clearly? Thank you. We do have a full agenda, a very full agenda. We have 4 items tonight to go through on our meeting and a bit of our work programme. So I would ask every committee member if you can keep your points concise, and if somebody else has already mentioned what you wanted to mention, whether you could forego that or put it in writing to myself, Democratic Services and any officers involved. I do have one further announcement, and that is to do with the triangulation meeting that the chairs of each scrutiny meeting had on the 4th of March. It was agreed there that each council leader would like each of their political party to go to them if they want to be on a task and finish group. So that includes us in the committee, but it also includes all councillors. Thank you.
Public speakers.
Right, we move on to the public speakers, and first of all I'd like to invite Gail Wilcox.
Who's outside? Speak into the microphone, and you'll have 3 minutes when I get back to the other end of the table.
Ron. Am I all good to go now?
Bear with.
Yeah. I'm coming in from this committee today to tell you how poorly this council has acted and failing my child and many others, relying them on for safeguarding support and an education. I'd first like to make this committee aware of the multiple freedom of information requests I've made in the last few months and the information I have found. At the time of the 23rd of January 2026, that only 79 alternative provisions were given under other reasons in the last 5 years. Other reasons can include, but not exclusively to, social and personal circumstances, preventative measures, emotional and behaviour issues. Specifically, in Sheffield Council's words, these young people would not otherwise receive an education. In addition to that, dated the 24th of January 2026, 1,447 are reportedly as severely absent, of which 327 are SEND needs. And it gets more interesting. From another request I received on the 12th, the same school my child attends, there are 61 children that are classed as severe absentees. Keep in mind, children are more likely to be exploited when not in education, cited by a 2016 study. Now, she hasn't been in a classroom since October and has only had 5 hours of tutoring after I threatened to sue the council originally. There are many reasons to this that I'm sure I'd like to discuss, but I cannot due to the rulings of here. Due to the rules of being here. But I also recently got my subject access request returned. I have seen phone logs from me asking to support in regards to my child's spiralling mental health. I have yet to see any support. There's also points where the council state about the failures of that specific school and did not even put in any support. They also included a conversation specifying my daughter's spiralling mental health and what she was doing. Despite knowing this, the council did not think it was important to place a Section 19 alternative provision or provide support for early help prevention or strengthening families. I'd like it on the record that certain council worker was previously in the MASH department. She has the experience and knowledge and expertise to suggest support and failed to do so. In January, I was told to my face my child is not entitled to a Section 19 alternative provision. A reason why was that she was enrolled in school. This is legally wrong. Social Ombudsman case 23004037 makes it very clear.
Ms Wilcox, sorry to interrupt you. I'd just like to say you've got 1 minute left. Thank you.
Please keep in mind that classifying a provision, a Section 19 provision provided by the school, a Section 19 support in internal emails. I have a history of bad mental health and I was gaslit, lied to and manipulated to my face in this very same council. As I've only got 1 minute left, I'd like you to consider what I've said before you make any decisions or vote on anything to do with SEN or CAMS. I'm asking for help, not to embarrass people.
Thank you, Mrs Wilcox. Can I invite Mrs Jean Lineker to come forward and speak to the committee? Thank you.
Oh, it won't come over. I'll put this one on, please. Unless I can move over. Oh, thank you. I don't think I need the mic. But I want to talk about SEND children. Now, there are a lot of SEND children. And SEND children, there's a lot of difference between autism and Down syndrome. And they're all SEND children, but they all need, it's the lack of information sometimes which is failing. Now, I've been a school governor of 3 schools many years ago, and we stopped Billingbrook School from closing down. So thank God it stayed. But Greenfield closed, and it's up in one of the eastern areas somewhere. The problem is the lack of information to carers with children that send children. And it's the lack of information on schools where they provide help. Headlands is a very good school, and I know that. Standon's Barn, I'm not sure of anymore, and Lings Lower. That's the 3 schools that I was at, and I helped with reading, for SEND children and everything else. And I'm just wondering how many councillors, if I can ask that question, are school governors. That is all.
Thank you, Mrs Lineker. We move on to item 6, which is the SEND Action Priority Plan.
No, CAMS.
Sorry, skipping on. We move on to item 5, which is CAMS. Oh, sorry, I'm doing good. We move on to item 5, which is CAMS.
Chair, Councillor Herring.
Councillor Heaven, sorry. Councillor Heaven, sorry.
Who's the cabinet member for children?
Cabinet member is Michael Stratton.
And why isn't he here? Isn't that supposed to be the case that the cabinet member should attend the scrutiny meetings? Because these are heartfelt pronouncements, if you like, and we're not in a position to actually do anything about it. But the cabinet member is, and the cabinet member should be hearing this, not us.
I do hear what you're saying, Councillor Heaven, but I do not know if he has something, another meeting or something. Yes, children's is utmost important to him, but he does have that opportunity to listen back, and as far as I'm aware, he has got an open door policy where any one of us can go and see him, obviously pre-arranged, and we can also write to him. But point taken, and for our future committee meetings, I will address that.
Well,
with him.
I think we should, as a committee, be writing and saying, please, could he attend where at all possible, or send a deputy, and actually make sure that a record is sent to him of the presentations that we've just heard.
Yes, yeah, I'm absolutely happy to do that as chair, and happy to take that forward. Ben Pearson.
Can I just address Councillor Herring's comment direct? Councillor Stratton has sent his apologies this evening. He had a prior engagement. Melanie Barnett and myself have gone through all of the agenda, all of the reports. We've also shared what we knew of the public presentations tonight with Councillor Stratton today, and we will follow up again with him at any actions that come out of this. So I recognise Councillor Stratton's not in the room, but he's fully briefed and fully updated of all of the papers.
I don't know when he was appointed, but I don't actually recollect that he's ever been. Not just this meeting, but I don't even know what he looks like, to be honest.
Okay, we move on to item 5, which is our CAMS report. So I'd like to invite David Williams and Loveliness Naya Gummo to come forward and speak to us. Thank you.
Thank you very much. Good evening. So both of us work for Northamptonshire Healthcare NHS Foundation Trust, and we've been asked to come today to just give you a bit of an update around where we are around mental health, emotional wellbeing services for children and young people. So I'll provide an introduction and just to set a scene for the paper, and then happy to pick up any questions or ways of working things through. What I wanted to start with is the paper sets out where we are, the range of services and the things that are being provided, but I wanted to start with just reinforcing that across West Northamptonshire, we're all working together around a strategy called Thrive, and Thrive provides space and opportunities for young people and their families to get different levels of support depending on the need. And it's really focused around, first of all, enabling people to get advice, and that being the first start. If we can get everybody to get advice, then actually it potentially means that people don't need to then move to the next stage of getting help. And then there are a range of services around getting help, and also more services including getting more help, and then specific targeted risk support for other people. So those 4 frames of the different bits of work that we do are all connected with the services that the local authority provides, with the voluntary community sector, and with our own services. We were asked to look at waiting times and ways forward, so I was going to draw out here, in terms of CAM services, which are child, adolescent mental health services, our waiting times continue to work through progress, ways of working, and as we've highlighted in the paper, initial appointments to see somebody in the NHS have reduced now down to 8 weeks. And a referral to treatment target time for the NHS is referral to treatment in 18 weeks. So we're working through that, and obviously we'd want to do things as fast as we possibly could. And then 7 days for urgent appointments and ways of working things through. So that's set out in the paper and a way of working. What I just wanted to bring you through into the paper was one of the figures that we've got there, which is that system level service map. And it provides a whole idea of the different organisations that are involved together in delivering mental health and wellbeing services for children and young people, because it's not just NHFT that are here providing services. So you'll see there, particularly at the early levels of help and ways of working, you have voluntary and community organisations supporting stuff, building things together, and it's a combination as it develops of other organisations, ways of working, including the council, including ourselves, and the police and fire commissioner. I kind of wanted to draw out some things about how do we help people reach services in different ways. Some people come to the NHS freely and because they want help. Other people won't come to statutory organisations like the NHS or like local authorities. And therefore our voluntary and community organisations are really important about a way of reaching people that won't necessarily come forward and reach things. So the Reach Collaborative are a good example of providing support in the community and ways of working. But here I just wanted to also highlight Northampton Saints Foundation as a way of bringing together and connecting with people who will come and get help in a different way because it's seen as a different bit. And it's that breadth and that way of delivering services in a multitude of different ways helps us build resilience in local communities and ways of working. I could talk for a long time around how the support, the ways of working and the things we're doing, but I'll just conclude by saying our ask and our way of working is this is all about how do we all prepare families and children for the future, and the decisions connected with this committee around housing, education and children all connect together. So in the NHS we're really keen to play our part, but it's also how do we bring all of that together, which will make West Northants kind of resilient community supporting children and families. So thank you.
Do we have any questions? Okay, Councillor Herrings and then Councillor Ashraf.
You say it's 4.5 months for the initial referral, but then you're very vague in the paper about what happens next, about the secondary referral, as in when something actually happens. Can you tell me, are you still doing, are these always face-to-face, or are you still doing virtual first contacts? Do you prioritise medical referrals, i.e. via the GP, as opposed to, because I know that referrals can be made literally by anybody, but do you actually prioritise where you're getting medical referrals through the GPs? And can you tell me where the crisis cafes are? It mentions, I think, 6 or 7, but it doesn't say where they're placed. Thank you.
Thank you. Just to come back, it was 8 weeks for initial. You said 4.5 months.
I thought I'd read 18.
No, 8 weeks is our service provision. The target is 18 weeks. So we are below where we should be on that bit. In terms of just a mixture of face-to-face and chat health, and then Loveness will talk a bit about the clinical prioritisation and the way of working. There's a mix of support that's available to people. I think it's really important to understand that alongside face-to-face appointments, we also provide a text-based service so that people can chat to us whenever they want and talk things through. That is important. Not every young person wanting help is in a position where actually they can make an appointment for face-to-face, being able to talk to a school nurse, be able to send a text message on the bus on the way to school, to be able to find a way of talking when you're at home, where you don't want necessarily family, where you're feeling it difficult to ask a question, are all different avenues of exploring and helping people reach help. So there is a range of different support and ways of working. But do you want to touch on prioritisation?
Thank you. I just want to add on to what David was saying in terms of the options that we have apart from just the face-to-face. Yes, we do have the chat health as well, but we also have options of where we can see young people virtually. So via Microsoft Teams, some young people and families prefer that. It's much easier for them so that we're not inconveniencing them from coming into our services. So that's also another option that we do have where we found that it is used quite a lot, our virtual option as well. Going back to the preferences, the priorities rather, where you mentioned the prioritising GP referrals. So we have a service which is called the Referral Management Service Centre, where all our referrals come through. So anyone referring into CAMS can contact our RMC and make a referral. We do have, like what David mentioned, the 7-day target for urgent appointments. Most of those we find they come from GPs. So if the GP does specify that this is a priority case, looking at the elements from the referral, we will prioritise that. But it's dependent on what is on the referral form.
You can yeah.
One of the issues that had been raised from our local GP was the difficulty in being able to make a medical referral. And then it was a 10-minute chat with a doctor over a screen who then actually prescribed medication without actually knowing the family, without knowing that person. And I would have thought I can understand when you've got a relationship with a young person and that you're maintaining a situation, but for an actual first referral, I think it's really important that we should be prioritising face-to-face so that the clinician actually gets to see what the situation is, what the family dynamic is, and actually assess everything about that young person, because it can be what they don't say, it can be body language, it can be all sorts of things. And I don't like the idea that you might be meeting your data targets by actually minimising what the service that you're actually giving. I'm sure you do not want to be giving a poor service, or you've got to assess the risks of that young person, particularly initially when that first referral takes place. So I'm only voicing actually the concerns from our local GPs. And I did ask about the Crisis Cafe as well. Thank you.
Yes, okay. We'll have the locations of the Crisis Cafe. Then we do have a bit of an order, so it will be Councillor Ashraf next. I just want to clarify. It will be Councillor Owens, then Councillor Baker.
Did you want to allow them to come
But yes, if you could come back on the locations of the Crisis Cafe.
Lovely.
Thank you.
I think the easiest bit for us, and actually would help with the notes and the way of going, is we'll share the website address at the end of the meeting, which has got a location. So actually then you've got a thing which enables you to be able to then forward it to any members of the public, which are saying this is where they all are, and a way of working. Just to come back on the other point, we do have access to both the shared care record, which is a care record which enables GPs, ourselves, University Hospital Northampton and others to be able to understand and look at individual care records, to be able to see and treat individuals. Everything is done on a clinical triage, so I'd be really clear, we are not sitting here trying to say that everybody would be treated online to meet targets. That's really important. People get the clinical triage they need in order to get the service, and I think many of us do get current GP services and primary care services where it's online, and ways of working stuff through. So a clinical decision is made about what's the best way to support that patient get the care they need within the time they need.
The reason I just wanted to ask about the Crisis Cafes, because I just wanted to know whether what we've got in the south, because for a long time they were just centred on Northampton, and I don't know where to find it.
Councillor Evans, could I ask you to stop now, because we've got a substantive agenda to get through. Thank you. Okay, we move on to Councillor Ashraf. Thank you.
Thank you, Chair. I just want to say thank you to the officers. I know how hard they work to put all the information together and all the partnership services that are actually out there. And I know how hard the voluntary sector also work to deliver the services to our community. I mean, as you can see, I'm quite vocal, I can speak English, and it's very easy for me to navigate around to find information. Just like the Crisis Cafe, I had to go into the website and go through every single page to find where I needed to go. But as councillors, we're very busy. No excuses, we are very busy. But sometimes if you have got a new agency coming up or something that you are actually working on, it'll be fantastic if you could just ping it over to us and we've got it straight away. Because I am forever updating my information, but I've got my information pack ready for all the services that I need to get in contact with. But the reason why I wanted to come in now is I accessed that very service not long ago, and I did mention in this room and 2 years ago, and it's new news here today. My son has suicidal tendencies, and I rang the GP, and the referral was made to CAMS. Within 7 days, fantastic. We went along, he went along, that's what he wanted. And we went through the assessment, a whole an hour and a half assessment. And at the end, we were told, oh, by the way, there's a 3-year wait. Now, you can imagine the despair in my son's face saying, I want to end it now, and they're telling me to come back in 3 years. I didn't know what to do. I cried with him in the car going home. However, I sought the support of local services, okay? I was not signposted anywhere else. I know Lowdown is available and all those support services. The difficulty is, up until recently, when my son fell into crisis, he was about to hurt himself just before Christmas. I phoned 111, took him down to the hospital. When I got there, my biggest shock was the CAMS team have a crisis team. No one told me this 2 years ago. All they said was, there's a 3-year wait, we will be in touch. No, it's not him. It's not him, no. No. Yeah. He's aware. All I'm trying to get across is where I felt failed was once my GP signpost to the appropriate agency, and that was it, I was left. But there was no support away from that. And where it lets us down is if all the other support services are around, I really hoped they came together for me at that point when it stopped. Because it didn't give me confidence that I can go back and say to my son, right, okay, how do we do this? But then, with the support of Lowdown and other agencies, not one agency, but different agencies, they supported us through this up until recently. But within one service, there was a crisis service. As soon as he was signposted that night to the crisis service, he was seen in 5 hours. In 5 hours, this was 12 o'clock in the morning we went, he was seen at 8 o'clock. And as soon as he got seen, he was a different child. So what I'm trying to say here is, if there are support services, and when a child is in that crisis situation, and parents are trying to reach out, and then we come to a full stop, it impacts not just the child, but it's the family as well. Now, I didn't have anywhere else to navigate that to because it's my family, my child. But I can imagine if there was another child, somebody else's child. And crisis point can happen at any time. And I just want that joined up approach because I don't know what other services are within CAMS or with Lowdown. But if that information is all on the website, there's a lot of information for us to navigate through. And if there is any changes, how do we, as councillors, get to know about it as well so we can share that with other families as well? And there's no criticism to anyone. I'm just talking about our situation.
Can I just ask, you feel that that would be crucial to have that information at the front of the web page, Councillor Ashworth? Thank you. Okay, we move on to Councillor Owen's question.
Thank you, Madam Chair. I think, from my point of view, I just want to identify myself to yourselves. I'm a paramedic practitioner. I work in a GP surgery. I did work in Northamptonshire. I now currently work in Milton Keynes. I have first-hand knowledge from working for the last 4.5 years in a GP surgery, the current CAM situation. I think most people know my scepticism of the current Thrive model, and I'll explain why I don't think CAMS is working as well as it could be, because it's all well and good having the appropriate policies, but in order for those policies to work well, you have to have the appropriate number of staff. Now, I know firsthand that within Northamptonshire, they have been staffing redundancies in CAMS. So if you've got staffing redundancies, how are you meeting those policies? Secondly, CAMS is a very stressful job, and I understand the clinicians might deal with that anxiety in several ways, and some of it may be higher sickness levels. So what are the current sickness levels of staff within CAMS? What's the current staffing levels? Is there a staffing shortage within CAMS? Because then that's going to affect the ability to provide the service with the demand. Certainly, if you listen to Councillor Herring and Councillor Afraf, who's got own personal experience, they're struggling to get services, and they're people who understand, who have a greater understanding than a layperson. So my point would be, is what are we doing to mitigate that risk? Secondly, what is the average waiting time between the first CAMS assessment and actually starting the treatment? What is that actual? Because we know from what's been published in the papers that currently what's happening is, with many other referrals that are being processed through the NHS, there is a lip service where patients are contacted once every 3 months by a telephone, and that's been counted as their first contact. But it's not their first treatment, not their first assessment, and then they're just putting further back on the list. And I think if you talk about a multi-agency service, so that's between CAMS, the NHS, the education providers, and the social services, as well as the council services, if, like they said, if one is breaking down, the others are going to face, not particularly with the council, it's going to face the financial risks and costs to the council. Also, you know, if we have untreated mental health that's not being treated by CAMS, you know, it's going to lead to more school exclusion, it's going to lead to more social care involvement, and how are we going to mitigate that? That would be my question to yourselves. Thank you, Madam Chair.
Thank you. Just want to be clear on a couple of bits then. So at NHFT, in terms of redundancies, 0. So where your info is coming from, it is incorrect. We have not made any CAMS staff redundant at all. In terms of just understanding where we are in the way of working, I mean, we constantly look at staff sickness levels, we constantly look at where we're going, how we work through things, and what we're trying to do. So currently in the CAMS team, we have 4 people off sick at the moment, with expected dates and support that's coming back to work through them. If I look at how we as a service, as an organisation, compare to other organisations around the country of our type, so that is community and mental health groups, there is what's called the People Promise, which is an anonymous staff survey which is completed once a year, which reviews where we are and where we're going. We are higher than our national average on every single People Promise indicator, which is a measure of how our staff feel. So undoubtedly there will be sickness, there'll be ways of working stuff through, but we really keep looking at the compassion, the culture, the understanding, and helping people to work. In terms of what are we doing to mitigate risks and manage things, actually the whole bit around the range of services, and Councillor Ashraf, you talked about the things about low down and the ways of working. Everything we're doing with West Northants Council is how do we mitigate risk. CAMS isn't every part of our children's health and wellbeing service, it's just a part of it. And looking there and saying, what can youth groups do? What can schools do? How do we build capacity and resilience across the path becomes a really, really important thing. And then in terms of average waiting times and ways of working stuff through, It will depend after the first appointment on the clinical need of an individual. So a high priority clinical need, and Councillor Ashworth flagged through some of the stuff that there is a CAMS crisis team and a way of working, could be seen in a matter of hours. Others it could take longer, and it will vary. It could be up to 47 weeks for somebody to be seen if they have a lower need and a way of supporting stuff through. But many, many people are seen an awful lot quicker than that as a way of working.
So just to clarify, and I said redundancies, could I just clarify with two quick questions? Number one is that there's been no redundancies, no mutually agreed resignations, and no where job refilling, so you haven't refilled someone's job post?
No.
Okay, and my second question would be, of the number of 4 staff that are off sick, how many of them are clinical staff?
So, I'm not going to answer it on purpose, because by sitting down and differentiating between 4 individuals and identifying who is clinical and management means those individuals might be identified. But that equally, our administrative staff are as important as our clinical staff in helping make sure that we've run appointments, we've connected people, taking advice, guidance from the phone. So it isn't as simple as just saying, if they've got a clinical qualification, it's a different issue. If we have a vacancy or a challenge in our admin staff, that affects the operational delivery of our services.
Thank you. Next, we're going to go to Councillor Baker.
Thank you. I'm not going to ask a lot of what I was going to ask, because it's obviously been asked before, and I'm hear our chairman's comments. We all know as councillors that people contact us all the time and tell us their story of what's been happening to them and their children. I know personally, and I have spoken about this in my own team when I was there, about my own grandson who was diagnosed with severe anxiety as a 16-year-old. And my daughter, who, I'm just going to say this because I'm going to show you that she's not a stupid person, is a university professor. They had a telephone call with a lady that couldn't spell their name properly and asked her 3 times how to spell Jake. And that was his assessment on your 8-week assessment. He was then told he was going to wait 18 months for an appointment, and obviously we didn't do that. We then had to find ways as a family to pay for that treatment. I think the aspiration is brilliant, but what I want to ask you is actually, can you see a point in the future when this service will improve to the level that you would like it to be? And what can we all do? I'm part of the VCSE Assembly, as you probably know, that we can all do to make a difference. And on my last point, we've looked up the Crisis Cafe, and you haven't got one single one in the south, but I would suggest that maybe the family hub at Toaster could accommodate one. Thank you.
Okay, thank you. Thank you, Councillor Baker. That's very helpful, and thank you for the summary. To focus on what can we all do, helping and support children and young people and families isn't just the NHS. It's about communities, it's about housing, it's about schools, it's about education, and it's about us all working together to make a difference. Doing that, supporting voluntary and community organisations to help people have the confidence to be really good parents, connecting with the services that West Northants provide, all make a really, really big difference. And if we take a moment, growing up nowadays is probably more difficult than it was when most of us grew up. And how we all come together to support people and give them the tools and the skills to learn to build resilience in their lives is really important. So what can you do? It's keep doing your job as councillors about thinking about families, young people, the environment, housing, schools, and so on, because all of that comes together to make a difference.
Thank you. Next, it's Councillor Aldridge.
Thank you. I'm not going to respond to the advice that we all just received, but I'm going to pick up the paragraph 13.9.8, which is about dual needs pathways that ensure CAMS and substance misuse services in Northamptonshire work collaboratively to provide an integrated, seamless response for young people. So I'm just wondering whether you could exemplify what that actually looks like, because there are young people who have multiple challenges, and substance misuse is a big area that a lot of young people are involved in. So I just wondered whether you could exemplify what that actually looks like.
Yep, we'd be happy to. And just to help you understand and just connect with stuff, so West Northants Council will commission the Substance Misuse Service, so it's an organisation that we work alongside as a way of working. Loveness will talk to you about how they connect and work together.
So the support that we would be offering the young person is to support their mental health, and the drug and alcohol services, they would be focusing more on that area. So we'll be working collaboratively, making sure that our care plans, we do it collaboratively with the young person and the family, as well as the drug and alcohol services. So we've just recently completed a SOP, a standard operational procedure, that we are using together with colleagues in the drug and alcohol services to ensure that all the interventions that we are delivering, we're working together with them.
So I'll probably follow up and ask some questions in writing, because I'd be interested to know how many, what impact, and what's been the outcomes for the young people who have engaged in the dual needs pathway approach, which I couldn't get hold of in terms of the information. Thank you.
Thank you. I think it would also be interesting to find out how, if the records are joined up at all, or how they could be joined up, because it was obviously be a lot for a young person to get onto CAMS and to, you know, admit to mental health issues, and then obviously substance abuse as well. So to have to go and repeat the story almost twice, how are the records joined up, and if they are at all, or how could they be joined up, please?
So one of the challenges about the support and the way of working through is that teams will come together and try and connect, but we don't, and organisations will talk to each other. There isn't a single care plan. That's partly to do with the range of providers that are currently providing it. But there is an understanding of how we all work together, but there isn't a single care plan. But it does reflect part of the complexities of children's services are the responsibilities of local authorities, the NHS, and ways of coming together. And it is a complex environment, but yeah, they're not a single care plan at the moment.
Are there any plans for that to happen, though, in the future? I'd just like to ask.
We keep doing everything we can to bring sort of we talk about MDTs, multidisciplinary teams, and people coming together and ways of working. We'd have to come back and have a conversation a bit more with West Northants about what you would like from your substance misuse service. We're not the provider of that, and the service specification and the relationship for the substance misuse provider in West Northants is directly between West Northants and the substance misuse provider, and we're there. So we are quite happy to work in partnership. There's a lot of examples we do. I can't promise to connect something at this point. I can talk about how, as a group of providers, we'd try and join some things together.
Thank you. I appreciate it's complex, and that's not necessarily for today, so thank you. Do we have any more questions? Councillor Chauhan.
Thank you, Chair, and apologies for missing the beginning of the meeting. I had childcare issues, but thank you for coming along, and do appreciate the time. And I know this is an area that is of concern to quite a few parents. And, you know, being a parent that's also had to use CAMS, we've got 3 individuals here already just sitting in this room that are counsellors that have had to access that service for their children at various things. So you can just imagine that amplified out in the community, how many people are having to access the service. And I think after COVID, obviously, we've seen that explode. We are seeing that in our communities, the people we're speaking to. And I think one of the biggest things we're finding is how to signpost people in the right direction to ensure they're getting the right support. You know, is it CAMS they need, or is it another service that they could also use? And I think that's really important to have that, because actually quite often you have parents that have come to you and they're in a crisis situation, and they're saying, look, I need support for my child, where do I go to? And they're being told, go to the hospital. And again, that then puts pressure on the hospital services and so on. But one of the things that came to mind was I believe at one point, the community mental health nurses were able to advise on things like medication and so on. And at some point that structure changed, is that right? Because from what I understand is obviously it's only the psychiatrist that can do that assessment when it comes to medication and so on. Could you just clarify that? That's my first question. And if the kind of stopping point is, you know, it takes longer for someone to see someone because they need to see a psychiatrist for medication, are there any plans to kind of, you know, rejig that, reshuffle that so that those individuals can get that support sooner? Thank you.
Thank you. I'll just set some context, and then Loveness will come through on the medication questions and respond on that. I think one of the bits that I do want to leave you with today is an importance of how do you help people at the earliest possible stage. So thinking about the Thrive strategy and the way of working, getting advice, if you're a worried parent and you want a bit of advice, or a worried young person, is really important. And so ourselves and the council and others have really invested in what can we do about advice. Then there's getting help, more help, and risk support. The bit I just wanted to highlight and come back to your point, one of the big investments that the government's made that we're rolling out across the whole of West Northamptonshire is about mental health support in schools. So really building resilience for teachers, building resilience for young people, being able to do some clinical sessions in schools so that people learn and understand and develop the skills that are needed. In terms of your specific answers around medication, Loveness will take us through that.
So just to answer that, it's not just the psychiatrists who would be issuing advice around medication. We have recruited some nurse prescribers, as well as advanced clinical practitioners who are a much higher level than nurse prescribers. So, and feedback that we are getting is they're actually really effective. Patients are able to access that support and advice in a timely manner. And if it's a complex case, it then can be referred to the psychiatrist to take over. So it's not just the psychiatrist. And actually, when we look at our waiting times for medic intervention, it's much lower as well.
Just a follow-up question with that as well. The other issue is that transition from children, and I brought this up in adults as well, is that transition from children to adult services, and how it's just like zero, that it just changes. You're cushioned at one point as a child. You're 17 one day, you're 18 the next, and all of a sudden you're an adult and you don't have that same support. Is there any, are there any thoughts on having a transition service between, that age group to basically help support that young person into adulthood, especially with their mental health? Thank you.
Yeah, I can. So within CAMS, we actually have a transitions lead, and the role of that clinician is to ensure that any young person going through that transition process is being given the advice and the support that they will require. And any consultation or conversations with the adults team is taking place. When we look at transitions, we normally would advise to start that process from 17 and 6 months, but we're actually starting it much sooner than 17 and 6 months. We start having those conversations at 17 and 3 months. So just preparing the young person and the family of what that transition and process will look like, and the other options that are out there where they can receive support after CAMS. It might not necessarily be adult mental health services, but what else is out there? So that's what we'll be sharing during that transition journey. And so on our system, it actually highlights to say this young person is approaching transition stage. Have you got a plan in place? And so we do have a transition plan, which we share with the young person and the family, and they contribute to that plan as well. So they're well aware of what the journey is going to look like. Yeah.
Next we have Councillor Herring.
Well, I just wanted to say, obviously we're coming to the end of this item, but in rounding up, as councillors we were told we needed to go out and do our job, and actually as councillors we all turned up here tonight as a scrutiny committee to hold to account and to listen to what is being done for our young people. And I have to say, from what I've heard, I am not reassured that all is well, and I would very much like us to be able to, as a scrutiny committee, take this further and delve into things a little bit deeper. And I hope fellow councillors maybe feel the same way. Thank you.
We do have a few more councillors, but we are going to be bringing this to an end shortly. We have Councillor Furman, then Councillor Owens, and that will be the last councillor to speak.
It's okay, thank you. Thank you, Chair, but someone else asked the question. Thank you.
Okay, so Councillor Owens, we'll move on to.
Thank you, Madam Chair. Councillor Herring, I second that. Very important. I do think we need to delve further deeper into this issue. Sorry, just going back to yourselves, Loveness and David. Did you actually originally answer my question, or is it not something you can answer at this moment, which was, what was the average waiting time between first CAMS assessment and actually starting the treatment? If you can't answer at this time, I'm more than happy to wait for an email. And I have a second question as well. My second question was, I've just quickly gone onto the Northamptonshire Healthcare job page, and I noticed there's a number of job vacancies within CAMS. Obviously, again, going back to my original point of staffing levels, would it be possible, I understand at this time, would it be possible to supply me with an email of what is the current staffing levels, active staffing levels within CAMS, and what in particular with those staffing levels, has staffing levels increased in the last 5 to 10 years, or has staff numbers decreased within the last 5 to 10 years? The reason I pose that question is we have had a substantial increase in population within West Northamptonshire, and I would hope that the capacity within CAMS would have increased with the number of people and number of children that we have also got now in West Northamptonshire. Thank you.
In terms of responding to your question, yeah, I did talk about how the fact that people could receive their treatment and their treatment time would depend on their clinical priority need, and that it could be up to 47 weeks for somebody of low priority. So I did say that earlier. I think your specific questions, it might be worth if that could go through James in terms of just being really clear about what the ask is, because there is an element of 5 to 10 years worth of data is quite a lot of data to identify and work through. So I'd be more than happy if you want to clarify that with James. James can have a conversation with us afterwards.
Thank you, everybody. I think that we've identified as a committee a number of areas that we'd like to look further into, maybe as a task and finish group. And those areas are the consistency and quality of signposting, having signposting there and having it available for parents and people in crisis. Also, the quality of the initial assessment has been mentioned, and severe questions asked about telephone conversations as opposed to seeing children face to face. Also, I think there's some questions over staffing as well. We appreciate that the ICB locally is responsible for staff, but we do appreciate that the national government is responsible for policies. But I think it would be fair to say that we take on board Councillor Herring's suggestion that we could potentially do something, and Councillor Owens has seconded that we could potentially do something as a scrutiny committee, but I will pass over to James to sum this up for us.
Thank you, Chair. I mean, just on the last point about the further scrutiny, I think you referred to the recent meeting of the triangulation group, which for members and others' information is the chairs and deputy chairs of the scrutiny committees, the cabinet members and the representatives of the officer leadership. So that had a look at various aspects about the way overview and scrutiny was operating, and I think one of the themes of that was the absolute importance of scrutiny being considered and focused and prioritised about what went into work programmes. And I'd say this is a real prime example where the committee today, having articulated the wish to do some further scrutiny in this area, there would need to be some further consideration, some further work on just exactly what, how, when and who before that went into the work programme. So the committee's identified this as a potential topic area. What I'm saying back is I think there's some further thoughts to go through before it goes from the identification of the potential area to it being plugged into the committee's work programme.
Thank you. Okay, we are going to move on to item 6, which is the SEND Priority Action Plan. And I'd like to invite Melanie and Louisa Jones and then Ben to speak to us. I just want to say thank you to the officers. Thank you, Lovely, and David.
That's fine. Lovely.
Do we have some? We have some more speakers as well. If you'd like to introduce yourselves.
We come as a SEND partnership.
Lovely, that's lovely. Thank you.
Partnership. So
if you could just introduce yourself, that would be wonderful. Thank you.
Hello everyone, I'm Rachel Akers. I've got a long title. I'm the Designated Clinical Officer for Children and Young People with SEND, and I work for Northamptonshire Integrated Care Board.
Hi, I'm Kim Stevenson from West Northants Voices in Partnership. I am an independent Parent Carer Forum representative.
And I'm Louisa Jones, Head of SEND for West Northants Council. So you would have received the PowerPoint, which is a brief presentation, so I'm just going to provide you with an update of where we are with our priority action plan. So West Northants SEND Partnership was inspected back in March 2024. We were expecting a monitoring visit 18 months later. We haven't had that to this point. We have had a stock take, which I will update you on, which is where the DFE and NHS England come and provide a kind of overview, have a look at what we're doing, and comment on the progress we're making towards the priority action plan. So when they visited back in March 24, they provided 5 areas of priority actions. The first was around leadership, partnership and leadership, focusing primarily on a joint strategic needs assessment from which joint commissioning can be developed. The second was around addressing the EHC assessment wait time, so it was beyond the 20-week statutory timeline. And then the third was around the quality, so actually when we carried out the EHC assessments, what were the quality of those plans? They found them to be poor quality and wanted to see an improvement across the advices as well as the plan. The fourth area was around the current waiting time, so you've just heard from our CAMS colleagues around that, but also in speech and language therapy and the neurodevelopmental assessment. But within that, also what happens while children, young people and their families are waiting for the assessment, and what support do they receive actually before, during and post-assessment, I would say, was quite important. And the fifth one was around improving our joint approach. So that feeds into area number 1 as well, around our joint commissioning strategy, around improving speech, communication and language needs. I just want to kind of highlight again that we are a SEND partnership. There's some of our partnership that isn't here, which includes our schools and our early years providers and our FE settings, which very much play a part throughout all of this as well. So I provided you kind of with the numbers and the breakdowns, but if it's helpful to you, I will just go through each priority action area, highlighting some of the main achievements and some of the next steps that we need to take as a partnership. So in terms of priority area 1, which is the partnership and leadership, we have completed that joint strategic needs assessment. Within that, I think one of the most important things to come out of it was a information sharing agreement, so we can really understand each other's data, combine that into joint KPIs. So we have developed a Send an AP dashboard so that we can see where children are across all of our services rather than individual services in silos. That has supported joint commissioning strategy, so that feeds into that, being able to see that real granular detail for children and young people really gives us an insight to be able to support the joint commissioning. We've looked at the tiered model of alternative provision as well, and we've developed a quality assurance framework for our alternative provision. We've introduced new casework management systems across NCT and social care, and also within the EHC team in WNC to, again, support that kind of information sharing, but also, especially within the EHC team, is to streamline the process and try and reduce that time it takes to make an EHC assessment. I won't go through them, they're in the PowerPoint, but it's those next steps. And from the stock take, they've highlighted that the next steps, they're really reassured by the shared evidence baseline within our joint strategic needs assessment and our joint commissioning strategy, and it's about the effective implementation now of our joint commissioning. So what do we do with it and how do we commission together? So then if I move on to priority area 2, the EHC team has been reorganised, and there has been investment, quite heavy investment within the EHC team to increase the capacity to meet the level of demand that we experience and continue to experience. Within that, there's been a detailed review of the end-to-end process, and that's in line with the new data management system as well. And it is about sharing the timeliness. It's allowed us with our data to share timeliness on advices that we're receiving when we request them, when we're getting back and sharing that with our partners. Children in care are prioritised throughout our process, and there is a SEND partnership guidance and policy to support that. Again, in the educational psychology service, there's been increased capacity supported by that investment in that service to support that, and that has managed. We were back then 300 in backlog, which had decreased to 0 a few months ago. So you can see the impact there. I think it's important to know that while we had such a significant backlog in EHC assessments, you couldn't see the progress through the percentage of EHCs completed in the 20 weeks. So we measured the average time taken to complete an EHC assessment, because that was the metric that was most helpful to us at that point. You can see that within a year, we've nearly halved, well, over halved the time taken to complete an EHC assessment from 54.1 weeks to 24.9, and that continues to reduce. We are actually now seeing, finally, that percentage increase of EHC assessments completed in 20 weeks. It has risen last month to 33.9%. We still have a journey, and we acknowledge that. And as the stock take showed, yes, we've made significant progress in improving that timeline. The next steps are continue that recovery and that trajectory. That trajectory is looking that we should be at least 75% by October 26. If I move on then to priority area 3, the quality of our EHCs, a huge amount of work has gone. I'm looking at Rachel, my colleague, because she's been leading our working stream, looking at quality assurance alongside our quality assurance manager. We have developed a quality assurance framework that is quite detailed across all 4 levels, starting at the individual service level and how they quality assure their advice is coming in, to then how they're translated across, to then multi-agency reviews of our EHC. What the fundamental bit of that quality assurance framework is the feedback loop. We're only as good as our learning and what we're taking from each of those levels and feeding back into the system. We've moved it to not just final plans, but draft plans. It's no good knowing that a plan isn't of good quality and still sending it out the door. So we have introduced new quality assurance measures at draft stage to ensure that we can make the changes before families receive the draft plan. There has been, again, a lot of investment in terms of SEND Academy training for the EHC team. to improve the writing quality understanding of what they're writing, but also we have also introduced AI into the process to support us in developing quality plans. And you'll see again, I've put the impact graph on there, and we're getting good feedback from families generally. I look at Kim at that point, to say that they're starting to recognise and see that quality, and it's coming in through compliments to our services. The fourth priority area in the action plan is the health waiting list. There has been additional investment and capacity into the speech and language therapy service, into the core team, but there's also part of that joint commissioning. We have jointly commissioned a specific speech and language therapy service for children with EHCs to ensure that they get the delivery as outlined in section F of their plans in settings. We're just rolling that out. It is a phased rollout while it allows the service to build capacity, and for us also, again, it's that learning curve as well to ensure that we're constantly monitoring and evaluating as we roll that out. It was interesting to hear one of the comments regarding understanding what is out there for our children and families. We have developed across the SEND partnership support maps for universal and targeted support that is available to families in 3 areas: in speech language communication, mental health, but also in neurodevelopmental areas. That has just been launched on the local offer and is available to all families. So just to highlight, and we can share that link because we need to communicate it and ensure families know where they can find the support. But in that, as our colleagues in CAMS were saying, actually it's everybody's duty to support these families. So how are we supporting that in our educational settings? Well, investment again has gone into a specialist teaching service with specialist SEND teachers that are supporting schools at the organisational level, looking at the systems and processes that they have in place to support children with SEND. Underneath that, we have our inclusion and intervention support teams, which you would have known as the SEND support service. We did a big kind of review of the service, co-produced it with families, school settings, etc., so that we maximise impact with the capacity that we have. I have evaluation data that's showing that that service has had excellent impact, especially on self-efficacy, so teachers' beliefs that they can meet the child's needs, but also parents as well. We're working around the family hubs. We have quite a wide variety of offer there. The SEND ranges have been reviewed and updated, and we have co-produced an ordinarily available provision document that is due to launch in May. So that is there to support schools and settings in the early identification, because actually if we can get the support in at that time, prevent needs from escalating, put in place the right provision, that's where we should be focusing. We've also commissioned therapeutic thinking for all settings. So that's a trauma-informed approach, and it supports our colleagues in education, again, in recognising, understanding the needs, but being able to manage and support them. The final one actually feeds in across, so priority area action 5, so it kind of overlaps. So I've talked about a lot of these before, about the EHC team, the SALT service, the language maps, but also there's a massive piece of work going on in CYP transformation at the moment, looking at the balanced system outcomes across the universal, targeted and specialist outcomes, and aligning them to then training and workforce development that's needed in each of those areas. But we're just mapping them across the workforce at the moment and then developing a workforce development plan. I said I'd be brief, but a lot to say. We've been quite busy.
Thank you. Do we have any questions? Councillor Aldridge.
Well, could I thank you, Louisa, for an amazing amount of work across your teams, and I was really pleased to see that not only have you described the actions taken, but started to highlight impact. And as you said earlier on, the inspection hasn't happened yet. And I know that from the inspection process, what inspectors will be interested in is the views and the perceptions of the users, of schools, of children and young people themselves. and what are the improvements that they identify. So I think it's really important to try and thread that element through under your impact sections, because I'm not seeing enough of that, because in the end, when you're externally evaluated, it is taken from the perspective of the users. So it's not about the delivery and the planning that's taken place, it's about what's the perspective of the users. So are you able to kind of highlight how you gather that information, and if you have gathered that information, what are the early indicators that you're beginning to see coming as feedback from the users? So I go into schools, I know what schools say, and it's variable in terms of their responses. Parental issues come through still as a concern by a number of parents. So what does it look like from that lens, from the lens of the users?
Yeah, that's fine. And I really want to thank you for raising that point, because we can do all of this work, but if it doesn't have an impact on the children and young people, what are we doing? So absolutely, thank you. Do you want to come?
We've obviously been on this journey along with West Northants, because we only came into our form in December 23, so only sort of 4 months before the Ofsted inspection. I would say we're starting to see green shoots. Turning a county is like turning the Titanic, isn't it? But we are starting to see green shoots. We're getting parents that are not wanting any amendments on newly written EHCs. I mean, I don't think I've seen that in 30 years. Went into a school the other day, 2 year 7 consults, and the head teacher said, I've been and seen them in year 6, and I can see the child in the plan. I don't think I remember a time where I've heard those comments, but it's early days. It's very, very early days. So we are still getting quite a few, and it's going to be time to turn around the old EHCs as well, isn't it? But we're going in the right direction.
I think if I also come in on that, we commission outcome surveys as well.
That'll be me, sorry, forgot that. We independently hold outcome surveys, so all of the WNC departments put a QR code on the bottom of their letter. Any of the survey feedback comes to us, because there was always that question of, is the data skewed? Is that what's going on? So all of the data comes to us, and then we report back to the teams and to the managers. But we actually see that data first.
And that's starting to show again positive, although I would, again, if it's looking at how you can support, it's asking people to actually fill them in, children, young people especially. We don't get the number back that we would hope, so we have to find a kind of variety of different ways to gain that voice. Part of that is in review processes, so we've done a lot of training into our schools, and we've produced a toolkit, a child and young person's voice toolkit, to enable them to really hear a child's authentic voice through the process and get their feedback on how they are finding the provision, how they experience the level of support. And we can see that in our Section A's when we do amendments, that actually that young person's voice is coming through of what they need, looking at how we co-produce those. We also, the services, educational psychology and the inclusion and intervention support team have a range of evaluation measures that we've introduced, and they provide termly reports of the impact that they have had. There's not a single methodology, because it depends on what intervention that they're putting in place, but I'm trying to make those as transparent as possible, looking at the best places to put them. We've had last terms, this term's I've asked for it the week after Easter, and it's looking at how we publish that so that we can share just what people are experiencing. I'm trying to create very open and transparent services within SEND.
Could I just ask a quick follow-up question? Sorry.
I wanted to partly reply to your first question, Councillor Aldridge, and I know colleagues have already. I think in the presentation you see the journey that we've been on. The description of turning the Titanic is about right, and it was. This was system-wide culture change that needed to happen. This wasn't across one organisation at all. This was across multiple organisations, across West Northampton, nearly 700 different education providers. Massive system change. What's happened underneath the data is genuine partnership around the table that we work around, and I feel like I spend most of my life with Rachel. We do. We work so closely together, and there is genuine respect across our partnership. We know how to hold each other to account. We know how to challenge each other across health, across social care, across education. But the couple of things I think I'd be most proud of is, from the very start of this journey, our parent forum had a seat at the table as an equal partner. At every board meeting, the first agenda item is feedback from children, families and parents, and we take it verbatim as it comes from families. That is the lived experience. That's the impact that we make. What we've just been able to do, we now have a shadow children and young people's board. Children and young people with additional needs that we have supported since the last summer. We now have children and young people with SEND coming and presenting to our board about their lived experience, and they will inform our future priorities that I will touch on briefly at the end of the presentation. So, huge system-wide change. Our schools are represented at that board as well. We have much better engagement from our schools at the moment. We can't have 200 schools around the table. We have really effective representation of both primary, secondary education and early years across our system. There is still a long way to go, but we've pointed the Titanic in the right direction now, and we all know which way we're going. That's the important thing, I think.
Sorry, my supplementary really is, as you know, I've worked in local authorities for many, many years. One of the things that you will all be doing is going through a self-evaluation process to present to the inspection team when it comes in. And that's going to be presenting all the fantastic work that has been done, but also the early indicators of impact. So in terms of progress that's been made, there'll be judgments made about how far has West Northants moved since its last inspection. And I don't really want to push you into this, but you'll have a view as to where you would pitch yourselves, or where we would pitch ourselves in terms of where we are now from where we were in a year and a bit and a while ago. Yeah, so just wanted to get some feedback on that.
Chairman, I'll respond quickly to that, and colleagues, please come in as well. So we should have been inspected last October in the inspection cycle. That's what we were expecting. We haven't. That's outside of our control, obviously. Councillor Aldridge is absolutely right. We have completed a self-evaluation as a partnership. It is evidence-based, it's data-led, and it is brutally honest about where we are, about the successes that we've made, but also about the areas we need to continue to improve. Within every area of that self-evaluation, we make commitments about what we will do as a partnership over the next 12 months. We've made those commitments to families, to children, to young people as well. We have shared that with both the Department for Education, NHS England, and the Care Quality Commission and Ofsted. And we had an annual engagement meeting with Ofsted recently, where they reflected back to us the progress that we are making. And there is confidence in the credibility of the plans and the people to take it forward to the next bit. So I think my response is, as a leader in this part of this system, I feel very assured in the direction we are moving in. I'm not going to pretend it's all roses, because it's not. There is a lot more to do, but we know what we need to do to put it right.
Yes,
just to clarify as well, in terms of the inspection we'll have is a monitoring inspection, so it's not going to be a full inspection, and what they will actually be coming in to look at is it's the priority action plan. That's literally all of it. So that's the 18-month inspection. The other thing I just want to make sure that all committee members are aware of, which I think you are, this isn't a West Northamptonshire Council inspection. It's a partnership inspection. So when Ben referred to the Ofsted engagement meeting that we had a couple of weeks, that was also had CQC colleagues on it. So I just wanted to make sure this isn't a council inspection, it's a partnership inspection, and that's why we've got what we've got colleagues from the partnership with us as well. So the monitoring inspection will only be on the priority actions which you've got in front of you. And I think just to add to what Louisa has said, there is obviously a lot more work that's going in behind the scenes, but the purpose of the agenda item this evening was just to update you on the priority action plan, which is what the presentation was. Thank you, Chair.
Yes, it sounds like you're doing some wonderful work. Well done, everybody involved. Next, we have Councillor Owens to speak, and then Councillor Baker.
Thank you, Madam Chair. Absolutely. I mean, I want to acknowledge the process that you've done. You know, in reducing EHC plan assessment. I mean, from 54 to 25 weeks is greatly significant. Okay, so certainly when I ask these questions, please don't take that I'm taking anything away from the hard work that you've already done, because that is not my intention. However, if only 34% of the plans completed within the statutory 20-week timeframe, that still means that 2/3 are late. And obviously this creates possible legal and financial risk to the council. So I have a three-part question. And again, I would say, if you can't answer it, just say you can email me, because I'll be more than happy to accept an email. All right? So my first part would be, what is the council's realistic time frame to reach consistent statutory compliance for the EHCP's completion? The follow-up question and part B would be, how many SEN tribunal cases did the authority face in the last 12 months? And the reason I ask that is because we know tribunals are expensive. We know that councils mainly lose them, and often these late plans, they drive appeals. So that's part two of my question. And certainly the final point is, working in GP practice, I see the absolute explosion in SEN. And I don't care what anyone says, it is an explosion. Probably about 25% of my working day is now taken up with SEN, just doing referrals. And I think it's because the spectrum is so broad now. You know, we used to have quite a small spectrum of what would meet SEN criteria. Now it's so wide. And everybody is looking for possibly a treatment and diagnosis and some sort of, you know, SEN availability. So given that we have, again, we're looking at possibly within a 10-year plan for 50,000 more houses around Northampton, potential for 150,000 more people. If we say 1/3 of that will be between 0 and 18, so we're talking 50,000 more children, you know, we're talking thousands more people. What is our current confidence that the improvements are sustainable given the demand for SEN in the future, not in the past? Thank you.
Okay, thank you, Councillor Owens. I can answer most of those questions, but the one that I haven't got the detail for, then I'll send to you. So I think the first thing to say, and this isn't acceptable because we all aspire to get 100% statutory compliance, the national average, so that's all local authorities, is just under 50%. So I think in terms of what you've seen of the improvements that we've made, no, it definitely isn't where we want it to be, but it's going in the right direction. So that's the first point. The other thing I just want to highlight, and this sort of links into your, can it be sustained? No. And Ben will talk about the white paper, because no, it cannot be sustained, and that's why you'll know about the SEND white paper for example, in terms of what's coming out. And just to illustrate that point, and it is a worry, and I think it's a worry for all local authorities, and I know it's a worry definitely for all directors of children's services. For us in West Northants, we average around 30 requests a week. We are now getting 60. So when we talk about the improvements that we've made, and when we look at what are the risks in terms of our improvement, that is the risk. Because Louisa has spoken about the additional investment that we've had, and the council has put in an awful lot of investment into staffing, etc. We know about the challenges with our high needs block, and we know, and Ben will update a little bit on that shortly. I would also encourage all members to attend the briefing that we're doing, Ben and I are doing next Monday evening, which will talk about the SEND white paper and go into more detail. So no, I can't sit here and say we can sustain this change, because we're not able to. And that's why we've got all of the new government policy coming out and the consultation, etc. Tribunals, yes, they've increased. That's the figure I haven't got in front of me, but they've doubled. And again, I would say that that's the case for most local authorities. And there was a national paper that was published a couple of weeks ago that illustrates that for all local authorities. And you're absolutely right in terms of the cost to local authorities, and we've got that cost, which I'm more than happy to share with you. The projections, Louisa spoke about those. I'm doing this from memory, Louisa. I think you said 74% by
October.
By October. If we reach 74%, and I'm not minimising the impact this has on children and families, if we reach 74% in October, I will be extremely proud and pleased with the team, which I already am. Because if you think about what the national average is, and you think about the challenging situation that we're all working in, and when I say all, I'm talking about schools, social care, health, if we reach 74%, then as a council, I would be extremely proud of that. And to say that, that isn't good enough, but I would be proud of that if you think about 12 months ago, we were on 2%. It's a challenging national, it's referred to as a crisis, and I would say my perspective is it is absolutely a crisis, and something significant needs to change around that to make sure that we get the very best outcomes for our children. So I will come back to you on the tribunal question, if that's okay. Thank you, Chair.
Can I just jump in, I think, Councillor Owens, on your last point, which is about growth. And I'd jump in to say, can I respond to that in the next agenda item? Because we're going to be talking about school organisation and population growth, etc. And I think that's the right place to come back to that response, if that's okay.
I think just to add to what Melanie's said about the projection of reaching the 74% by October 2026 that Louisa mentioned to us, we just don't know the direction fully of the white paper. We know what we know, but we don't know how it's going to shape, how the national government are fully going to shape it. But what we do see in the white paper is that it's looking likely that EHCPs are going to go to the most complex cases, rightly so, as children really need those, but they're going to be looking at inclusion into schools. So I think that to have that 74% is amazing, especially in a landscape that we don't know what it's going to look fully like in the near future. Thank you.
Chair, if I may just come back in on that, and I think you're right, that seems to be the direction of travel in terms of EHCPs, but it is subject to consultation. But the reason we are seeing this significant increase in requests, which we've seen over the last 6 to 9 months, is because parents' fears of what is going to be provided for their children. So I think, to be perfectly honest, we're in a perfect storm here in terms of the demand increasing because of the worry and the uncertainty about what might happen in the future. So, there's risks. I don't need to spell the risks out because I think it's really clear in terms of the risks, mainly for children and families, but also for all partner agencies that work with our vulnerable children and families.
Chair.
Yes, sorry, Ben.
I know this is the Scrutiny Committee, but I think we actually need to give some credibility to the teams that have been working on this. We had quite a job to start off with to get the extra funding for what was about 22 new people. And Louisa, who's doing a fantastic job because she wasn't here at the beginning. We had I don't want it to be Titanic because that sank. I say it's like turning an oil tanker. Turning an oil tanker, because then it turned around and floated off. So I think that we had a massive crisis after COVID. We had hundreds and hundreds of people that were totally dissatisfied with what was happening with their children, quite rightly, and we had a huge mountain to climb, which we're still climbing. But what I've heard tonight, I was absolutely thrilled that the things that we thought might work are actually working. So that is a really excellent work that all of our officers have done, because you can have some thoughts in your head about a plan, but actually seeing it really turning around and working is amazing. There was a couple of questions, but I won't ask them now because you've answered them in things you've said. But my worry, as you know, because you all know why this is a worry that I've always had, we're doing all these EHCPs. And they're also then having the opportunity to choose different types of education. So what is the thoughts on the capacity to actually accommodate all of these children that have got the 74% of plans into school places, because that's the real big challenge, isn't it? Not just having the plan, but where do they go next and what school places do we think we've got available? I know we've got a new school, but there'll be others that need different types of schooling to that. So have you got thoughts on that too?
I'm happy to respond to that quickly, Councillor Bacon. I know other colleagues may come in, and this may well play out in the next agenda item as well, when Shazia talks to us about school organisation. The landscape has changed, or is proposing to be changed within the white paper, and I'm happy to do a very quick overview of that. I know there's a member briefing session specifically on that next Monday evening. I'd urge everybody to come along to that. The direction is really clear. The direction of travel, nationally is very clear. Local mainstream education should serve its community, and if the community's needs have changed, then we need to change with it. That's the direction of travel. There will always be some children and young people that need much more specialist education, but that should be a much smaller percentage than is currently now. So we have got a lot of work to do. Making a statement that says all local schools will be completely inclusive is very easy to say. We know that's worked when families aren't banging down our door to say, I need specialists, because they have the confidence in the local school to meet their child's needs, whether they be physical, whether they be medical, whether they be learning difficulties. We need to build that confidence. That goes in retraining, to a degree, an entire workforce. That doesn't happen overnight. So I don't want to build up false expectations and false hope, but the direction of travel for the future is very, very positive. Councillor Baker, I know you know we've built new schools, we've expanded current special schools, we've built new specialist units, we have built much better engagement with the leaders of those units, and where it's appropriate, we will continue to build more specialist units. Now we have that JSNA that Louisa talked about, that Joint Strategic Needs Assessment. We have absolute granularity in where our children live and their needs, so we are able to commission it much more accurately now. So I feel confident about the future. The other part, and I will touch on this, and Shazia may mention it briefly later, is as we design any new school in the future, whether that be a nursery, whether that be a primary school, a special school, or into further education, those schools will be designed to be more accessible for all pupils. It's been the way that schools have been designed in Scotland for over a decade now. You have to design and build schools that have more breakout areas, that have sensory rooms in, that have that ability to provide medical support in. All of our schools in future will need to be built that way, and so should they be as well. And that will enable and support schools to be able to accommodate more needs locally.
Sorry, Ben. Can I just ask on the back of that, really, I don't want to give you a headache, but what about the schools, particularly the secondary schools, that are bulging at the seam? My ward is bulging at the seam. And, you know, they've got no extra space. You've got heads, fantastic heads in many, many schools, well, probably in every school, I should say, you know, doing their best with SEND children, providing classrooms and places for them to go with TAs and additional staff. But what will happen in terms of sensory rooms and places there? Thank you.
Thank you for the question. I don't think meeting the needs of a community is necessarily about building more. I think it's about making every single classroom inclusive. I think it's ensuring that every child feels safe, feels welcome, and feels able to go and learn in every setting. There will need to be some changes and some modifications to some schools. We're doing that already. We're creating additional specialist units within secondary schools right now. New one will open in September. So I don't want the message to be we're going to rebuild and we're going to have this building programme that involves changing every single one of our schools, because that will not be the answer. That will be in some cases. So it's partly about creating the right physical environment. The bit that drives me more is creating the right atmosphere and culture within schools where everybody is included, welcomed, and everybody's needs can be appropriately met. That's what we've got to do.
Okay, I believe it was Councillor Owens, and sorry, I did see you, Councillor Aldridge. It is you next, after Councillor Owens.
Thank you, Madam Chair. Again, I just want to reiterate, I'm not taking anything away from the absolute amazing job that you've done. That's not the way I pose my questions to people. But I'm critical, okay? And for example, I understand what you've said, but in my other role as chair of the audit committee, I just want to let you know that the inability to meet the statutory duties of educational needs has now moved into the catastrophic at-risk register. So I understand that. I just want to highlight that from an audit point of view, it's now in the worst case possible. So as long as we always have that at the back of our minds, then obviously any way we move forward from that is going to be beneficial for the children, first of all, and also for the residents, and also for the schools, and also for the council. Thank you.
Yes, Councillor Owens, I completely agree in terms of the sort of audit review and the fact that we're in a national crisis, and rightly there's going to be transformational change. And there lies the challenge as well, because we are going to require cultural shift to happen in schools, because what we've got is a system that's been in operation for a number of years now, and some of the teachers have actually been brought up as teachers in that system. So their solution to the delivery of those additional needs is turning externally as opposed to looking at practice within schools. So I think what we're going to end up with is a massive cultural shift, which will require not only a change in mindset, but also a lot of training and support and a set of expectations that are completely different of schools. So we do have a mammoth task in front of us. The whole system has a mammoth task ahead, and it's about managing that well. So I think the next 2 to 5 years are going to be particularly challenging. And I want to just say thank you again, as I did at the beginning when I first spoke, for all the hard work that you've all been doing.
Chair, I don't know if this is a good time, but just to do a very brief mention of the white paper. I know we've touched on it slightly earlier. There is a dedicated session, it's an hour and a half next Monday evening, online briefing. There will be more, because there is more detail to come out. So, and I would really urge everybody, so I'm not going to go into massive detail at all tonight, but we've already mentioned a lot of the intentions. Firstly, the white paper is not a SEND white paper. It is a schools white paper. There are proposals about transforming education that are not just about SEND at all. They are around lots of governance, around the way that schools are supported, funded, around expectations. There is then a sub-part of that white paper that is a consultation specifically about SEND. There's a lot of detail in both. I think we've had some fantastic conversations within our partnership. The volume of work that needs to be done quickly to demonstrate our preparedness is scary, frankly, but we've got the right people to do it. This is a once-in-a-generation opportunity, and we are excited. There is a lot of work to do, and to keep the very good point from Councillor Baker, not the Titanic. There's something that doesn't sink, going in the right direction, and to keep that progression moving, and to keep going towards that target that we've already talked about, and others. But this really is a brilliant opportunity to rewrite the landscape for our children and young people, not just for now, but for future generations as well. And we've got the right leaders across health, across social care, across education. Our parent forum are phenomenal. Our young people have got some brilliant ideas. So this is an exciting time. I'm happy to provide more detail around the white paper, but I really think next Monday is the time to really dive into the detail of that. I'm very happy to take questions in detail next Monday, if that's okay.
Yeah, I think we just have 2 more questions. I've got one, but we'll take one from Councillor Furman, and then I think we will move on to the next item agenda.
Thank you, Chair. And thank you, other councillors. Thank you, Fiona Baker. It was, I fully reiterate what she said. And thank you, officers. I think WNC are very, very lucky to have you all as a team. that's for sure. But the areas that I'd just like to point out, and was identification of unmet needs and gaps. The report should address the underserved groups, geography, disparities, SENS needs and cultural barriers. I don't know whether that's going to be in the Teams meeting next Monday, is it? So, and the other one, and it was purely because you mentioned this as well, was coordination and pathway clarity. The report could explain how multi-organisations avoid duplication and referral flow works for families. Thank you. And thank you, by the way. Thank you all.
Sorry, we'll pull the responses in around the white paper, and there will be a response in there around how we're avoiding duplication and how we work as a partnership as well. So I'm happy to bring those in next Monday if that's okay. No problem.
Well, thank you.
Sorry,
Councillor Owens, quick question.
For those of us who won't be able to attend on Monday, there'll be a full debrief and minutes and points of that white paper, because I unfortunately I can't make next Monday. There are some slides already produced. There will be notes of that. What we will be doing over the coming months, because the detail is still to come. We're still waiting for the financial settlement that comes alongside, for example. There will be updates and there will be a frequently asked questions that we will provide for councillors to be able to respond to residents. But we'll provide that up. Then there'll be a running narrative about the white paper and how we're going to implement those reforms, definitely.
Chair, if I may, I believe the session will also be recorded and shared amongst councillors for those who can't attend.
Thank you, everybody, and thank you to all the officers and the Parent Care and Kim from the Parent Caring Forum. And I think it's actually, you know, a huge task, as we have all said in our conversation and as the officers have presented to us. But I also think it's exciting. It's exciting to see reform in education, and I think two of the biggest things here are actually going to be Councillor Aldridge did touch upon education and culture of teachers and people within education, families and children. But I think one of the biggest things also is going to be a whole different look at education and maybe how education can be multisensory. And I know largely we take our directives from national government, but there are schools and there are maintained nursery schools that West Northampton Council have put funding into, so have some input into, whereby we can, you know, we can make recommendations and changes in towards education and education reforms. So I think it's really going to be exciting to look at multisensory and everything that will be needed for SEND children to incorporate into learning. And many of them will learn, and many of them are, you know, just as clever, if not more clever. So I think it's exciting the way forward. Thank you, and over to James to sum up.
Well, not so much a summary, Chair, as a question back to the committee. What is the conclusion, the outcome it wishes to put down as a result of this discussion? And, I mean, a lot of the themes from individual councillors' comments have been very positive about the progress made. And this kind of goes back to a point that Councillor Baker made, that Scrutiny should acknowledge when there is a positive situation. Yes, absolutely it should. Scrutiny can be seen as a negative process. It's about finding fault. It's about telling an organisation what they should be doing better. Yes, scrutiny should be about challenge, but if the outcome of that challenge is, all things considered, objectively, scrutiny is satisfied, is confident in the direction that things are going in, then scrutiny should absolutely say that. And without wishing to underplay the challenge that there is in this whole area in the future, which has also been touched on during the discussion, if the committee is satisfied, is pleased, welcomes, is confident in the direction being taken and the progress being made, then by all means you should be saying that.
Do you want us to answer?
Yes, because ultimately it's the committee's conclusions. I might help you formulate that, suggest how you might sum up what you've expressed yourselves, but it's for the committee to decide what it wants to conclude.
Well, I think that we should go exactly with what you've said, because I'm not going to repeat all of that again. But I do think that the one thing that we put a lot of pressure on all of our officers to do a good job, and that's what we should do as a scrutiny committee. But I think, as you said, we should therefore then give them reward in kind if we think that they're doing the good job that we wanted them to do, and it's turning our oil tanker around. So I think that nobody's saying we've got there yet, and I'm not sure whether we ever will get there in this world of trying to educate all these different types of children, but we're in the right direction now, I think, and I think that's what we should say that we've learned from this meeting that we've had with these officers tonight.
I think Councillor Aldridge wanted to add a little something.
If I could just say that I think with the work that has been taken forward and driven by Melanie and Ben, I think we're in a much better position to face the massive changes that are ahead of us. Had we not been there, we may have been struggling. So I'm really pleased to see that we have made the progress we have, places us in a much better place to deal with what's coming over the horizon, and it is massive. I've been going through the white paper and looking at all the implications. We're talking about, schools becoming being part of multi-academy trusts. There's a massive amount of work to do there, along with the SEND reforms. So well done, everyone.
Yeah, I think Councillor Chauhan.
Thank you. I wasn't going to actually ask a question, but I will now. Very quickly, so with all of the new house building that's going on, obviously with the local plan, I know in Coventry, for example, in my area, there was a school that was due to be built, which is no longer going to be built.
Councillor Chapman, I think that's coming on our next agenda.
Oh, is it? I thought we were on there already.
School placement. Yeah.
Have you got that?
Yeah.
Perfect. I'll ask it then.
Yeah.
Thank you.
So, yeah, I'm sure we all, as a committee, we all echo, well, thanks to you.
I think that item went on for so long, I thought they'd merged together.
No, it hasn't merged.
Thank you, Chair. I just want to say thank you very much for the compliments, but I really want to emphasise this isn't about me and Ben, it's about the whole partnership. So I know that people have referenced officers, but there are colleagues from, we've got the parent care reform, we've got health, we've got social care, etc. And I think what we all need to recognise, everybody sat around this table, is actually it's the people on the ground that are doing all of this work. So I know that you will join me in saying a massive thank you to all the teams that have been working really, really hard to do that. So just wanted to make sure it didn't come across this is about WNC, because it isn't. It's a partnership, and I hope that you've seen that this evening with the representations. Thank you, Chair.
Okay, we're going to move on to item 7, the school place planning. And I'm going to invite Shazia Omar to come forward and speak to us.
Chair, can I do a quick introduction just while Shazia comes up to the front? And I've already mentioned there are some obvious links back to the previous conversation we've just had. There was a request back through from this committee to talk through our role around school organisation and around ensuring there are sufficient education places to meet the needs of the population. That's our statutory duty. You've heard a massive journey, and I do take Councillor Baker's comment, not the Titanic, but we've turned that oil tanker in the world of SEND. And I just wanted to give just a little bit of context behind what Shazia is going to talk us through in a moment around school organisation planning. Shazia and I both joined this council about 3 years ago. There were over 600 mainstream children without an education place at the end of August to start that September. That kept me awake. There should not be any at all. there were over 600. Shazia and her team put that right and have fixed that situation really quickly. There are no mainstream children that are waiting for the offer of an education place. Yes, there will be in-year applications. We'll get applications throughout the year, and sometimes there's a small delay in that. But I wanted to just put that tanker turning has happened in school organisation and in school admissions over the last 3 years, and has been put right at the same time as we've been doing all this SEND work as well. We're not here to talk about that history, I know. What Shazia is going to do is talk through our school organisation planning, and in some of the detail. We're lucky we've got Simon Bowers with us, AD of Assets and Environment. Something like that. We work very, very closely. Obviously, the planning and the education needs comes from the education side through Shazia and Co. Simon's colleagues manage the planning side, the building side, the making sure we've got that sufficiency. So we work really closely together. And I think we'll be able to field those questions if any questions come in. Shazia, I'll hand over to you now, if that's all right.
Can everyone hear me okay? Yeah. So my name's Shazia. I'm the head of place planning and admissions, and as Ben said, I've been here for, I think, almost 4 years now. So what we're going to focus on today is the formation of the school organisation plan within the presentation that has been set out. Essentially, we're aligning the school organisation plan with the local plan so that it spans over the next 18 years. So we know how much housing is coming forward and the impact that will have on education. So if we can just go to the next slide, which is the key information that will be captured within the organisation plan, which will hopefully help schools and help all affected parties be able to plan effectively in terms of growth, where there is housing coming forward, and also a reduction in demand as a result of a drop in birth rates and a drop in inward migration. So the organisation plan captures demand by planning area, which I'll come on to. It also captures the impact of the new housing coming forward over the next 18 years. And we also talk about the methodology that we're going to be using to ensure that we secure the right amount of financial contributions through Section 106 to build new places where we need those, alongside working with schools to reduce the capacity where there is an excess of places. So the next slide shows the planning areas that we have for primary. So we split WNC into 20 different areas. We look at, when we're setting the planning areas, we look at reasonableness of distance. So we want every family to be able to access a school within 2 miles, ideally, so that families can make journeys by foot, and also they can maintain friendship groups by having access to good local schools. So that's shown within that diagram there. Similarly, we have planning areas for secondary, and we have 6 of those. Because for secondary age children, they can travel a bit further, they can travel a bit more independently, and therefore schools can be within 3 miles or so. But generally, we don't like children to exceed journey times of 75 minutes for secondary age. So those planning areas are set. We then submit our forecast to the DfE on the number of places that we have within each planning area and the number of places that we expect to be taken up by children coming in over the next 5 to 7 years. The new local plan sets out an ambition for up to 48,000 new homes. Thank you. And what we've done is looked at that housing within the local plan, and we've looked to see where it sits within each of those planning areas that I've just mentioned. That will enable us to identify where we need to create new places, where we might need to take forward new schools that are being set out within the planning application, and where we might make a decision to not take forward certain schools. So that's all captured within the new plan. If we move on, the housing what we've done is broken it down by the planning area, and the different colours signify where we've got the most amount of housing. So the darker blue is where we have a significant amount of housing coming forward. So as an example, NN4 South, where we currently have a surplus of places, where the local plan suggests there'll be about 6,000 homes coming forward, which will result in a real pressure on the existing places. And it will also result in a conversation being had with developers and planning about the new schools that are land being reserved for schools within the applications, and whether we take those forward or not. So, so like I said, we've done a really detailed piece of work on breaking down the planning areas by housing. It's also shown by secondary, and secondary, as you can see, the most amount of housing will be going into Northampton town. And I think there's a significant amount of housing. There is some numbers within the diagram as well. So I think we've got 17,000 homes coming forward in Northampton town. And we already have a pressure on secondary places. So we know that we're going to have to create more secondary provision. The next slide gives us an overview of the reserved education sites we have across WNC. So we have 15 sites reserved for primary. We don't have any sites, well, we have one site for secondary, but I'll come on to the status of that. But for primary, we have 15 sites reserved. Most of those are reserved within Northampton town, and we have a couple in Daventry and one reserved in Towcester. So I hope you take the time to look at this, and then you can ask any questions around that at a later point, because there is a lot of information within here. If we then go on to the next slide, what we do in place planning is look at each planning area. We identify how much surplus capacity we have at the moment, or where we don't have any places, that's down as an area of demand. As an example, we have the Chendrit primary planning area, which has 30% surplus capacity, and then we have an area of Brackley which has zero capacity. So we look at each of those and then formulate a plan as to how we can mitigate the demand or mitigate the surplus. We've then added on a layer of the housing, and our predicted forecasts show what our final position will be once those houses come forward. It is only an estimate at this stage, because we can only really predict with any accuracy beyond the next 5 years. Beyond that, it is an estimate, but the estimates suggest that we'll be significantly short of places in quite a few areas. And within the table, we set out what our plans are around those. So we've done that for primary, we've also done that for secondary. We can go on to the next slide. Of the 16 sites, primary sites reserved, we have one being delivered, which is Overstone Gate, and that's due to complete by September 26. So the school's already open, but it's in contingency accommodation at the moment until the new build is ready to open in a few months. We have 5 sites that are provisionally being taken forward, so we're in conversations at the moment with developers around when we need to take those forward and when we need to put together a technical team who can go out and visit the land and make sure it's okay to transfer, and that's dealt all by Simon's team. We have 5 sites that are under review where we think those sites may be needed, but we just want to do a little bit more analysis around the data, and we don't want to impact on existing schools by taking schools forward, which could result in some schools having surplus capacity. And then there are 5 schools that we're not taking forward because there is additional capacity within those areas that could accommodate the yield coming forward from housing. Of the sites that are coming forward, that are definitely coming forward, and we're now working with Simon's team on that, and they're all listed there, largely around the Northampton town area, and we're proposing a new school in Daventry North East, which is subject to planning permission. Of the sites that where we have land reserved, but the requirement is still being assessed, again, around the Northampton area and one in Towcester. And then finally, we list the schools where land is reserved, but a new primary school is unlikely to be taken forward because of existing capacity and the impact on existing schools. Yeah. So moving on to how we determine the amount of pupils, we take the DFE rate. So when we look at, for example, 1,000 homes, we apply a multiplier of 0.34. So we say 340 primary age pupils will be yielded per 1,000 homes, and about 160 secondary age pupils per 1,000 homes. And that's taken from the DFE rates. We also take the DFE rates for working out how much it costs to build a school. And so when a planning application comes forward, we want to ensure that we get the right amount of money, and we're estimating for the right amount of children, which should give us then the correct amount to build a school or to permanently expand an existing school. Yeah. So a lot of data and a lot of information, but hopefully it sets out the intentions of the place planning team and how we can ensure that we're able to mitigate against the future housing and future growth.
Chair, can I just add a tiny bit more detail?
Yes,
and I know
yes,
we need to open to questions. I think what Shazzy's gone through is there's loads of detail. I know you've had the slides in advance. I'm obviously happy to take questions. It's a really difficult balancing act because we have to have sufficient places. But if we create too many places, what we do is we destabilise all of the schools in a local area. So if we build a brand new school next to a current school and there isn't the capacity, what that means is we've got 2 head teachers that we're funding. You've got 2 Senkos, you've got 2 site agents, and then you get 2 schools fighting over staff. And then what typically will happen is you'll have one high-flying school and you have a sink school. That's the worst thing to do for that community. So it's about getting a balance of ensuring we meet that statutory duty of having sufficient places, but not creating too many, which A, is a waste of taxpayer money, but B, really destabilises local education systems. And for the first time since I've been here, and Shaz and the team have done, we've now got a really clear plan that is very data-driven, that's very accurate, that we will share with all of our schools, with our multi-academy trusts, to help their planning for the future as well. That's the art of this game, and it's a complex game, forecasting pupil numbers across such a big area, but I think Shaz has gone through a really clear presentation of how we do it.
Can I just add on to Ben's point, sorry, about new schools? When we have a school reserved within a planning application, the final decision doesn't sit with us as to whether that school opens or not. The final decision sits with the DFE. So if we aren't able to clearly evidence the demand for that school, the DFE just won't approve the application because all new schools have to open as academies. And so we had the case of Overstone Gate where it was touch and go as to whether the DFE would approve it because there was some suggestion that it would impact on existing schools. So the final decision does sit with the DFE and it's based on the forecast that we submit to them each year.
Right, I think there's an order again, as many councillors want to speak. It's starting with Councillor Chauhan.
Thank you, Chair. I can ask my question now. Thank you very much for that presentation, Shazia. It was very helpful and very detailed. As mentioned, there was a school in my ward in Coventry that was due to be built, and now it's not built, and now it's not going to be built. But within the place, I think the developer now wants to build additional housing, 60-odd houses, which then means there's going to be more children, as in, you know, in that area, in which we haven't obviously accounted for. There are a couple of questions linked to this. One was, why are we not building through schools? Why are they just, I know it's cheaper for developers to build primary schools, but why are we not fighting for through schools to say, actually, you know, this will be your primary and your secondary? Because what I seem to see is a pattern where we have a lot of primary schools being built. That's my first question. And the second question was, you know, in this particular case, I know the developers already handed over, I think, 3 or 4 million for the school. In terms of planning, and I think this might come into Simon's remit a little bit, are we not able to say, okay, if you can't build a school here, obviously there's going to be that demand for that health infrastructure. Why can we not build another, I don't know, a GP surgery or something that's going to benefit residents, the public, not just additional housing? So that was my 2 questions. Thank you.
I'll come in on your first question, and then I'll pass over to Simon and Ben for the second part of your question. So a lot of these houses, schools that are coming forward, are based on Section 106 agreements that were drawn up 10 years ago or so. And at that time, the preference was to build primary schools. I think it's more attractive for developers to have a primary school within the application because they're attracting young families into the new homes. What we have done since, for the new applications that have come forward, is really explore the all-through school. So for Daventry, we have said exactly that. We said we want an all-through school that goes through from the ages of 2 to 18. And we're looking at a similar situation in NN4 South, where we want to see if we can build an all-through school rather than having 5 primary sites there. Wootton side, yeah. So Wootton already has 2 all-through schools. And to have a third there, we think the model works well. Wootton works well. Caroline Chisholm works well.
On that, Kate, on that very quick questions, I know the traffic there is horrendous when it comes to school pickups. Yeah. So checking another school there, why not put one in Coventry where it's just down the road and you won't get that same kind of backup of traffic and, you know, all the other issues that come with it for residents?
Yeah, I mean, the planning application will take all of those things into consideration, traffic, and it is around land and reserve sites. And I think you need about 10 hectares for a secondary school, about 3 hectares for a primary school. So it's whether there's sufficient land within the Coventry site. But that's kind of a bit out of my hands and more around planning. So I'll hand over to Simon for the question around Section 106 variations, because I know they're not straightforward.
That's better. Yes, there we go. Pressed the button too many times. Right. Series of fairly complicated issues here. As she's already alluded to, a lot of the stuff we're dealing with is legacy Section 106s, negotiated on terms that, frankly, I would not have wanted. There is one I won't name precisely, but it says, for the secondary school to be built in this particular location. You think, why did you do that? Because it just means that if the school isn't built in that location, that entire 106 is unenforceable. So there are some key principles we're building into the new structure of the 106s, one of which is the contributions are taken, and while we might take sites, the 2 are not linked. So as long as we use the contributions to achieve the purpose, which is providing the educational need of the development, then we can use them in the most sensible way. Because, you know, we think we've got this great plan at the moment about how we're going to deliver the need for Daventry and for large parts of Northampton. Reality is the world's going to change. And whatever that plan is will probably not be right in 10 years' time. So we have to have the ability to flex and to move to make things work. Having said which, we're working together really well with the planners, with education and with ourselves to make sure we get the best out of what we've got. And in terms of getting the best out of what we've got, Shazier's kind of alluded to it, there are only so many sites that are big enough, and we might want to put a site where a school where you would ideally like it. If the site's not big enough, we can't do it. So we just got to work with, with the ingredients we've been given to some degree. So we will put the school in the best place we can, but that might not be the ideal place if you had a blank sheet of paper and you were just to put it, choose your site. There's 20 years of history of landowner deals, of planning applications, of Section 106s, yada yada. And all of that comes together to give us the situation we've currently got. So I think there's a good plan coming together and it will meet the needs. It won't be perfect.
Councillor Chahand, could you use your
I said my other question as well, which was about if the doctors aren't, sorry, if the school's not being built there, another public building like a doctor's.
Right. Try again. I interpret red as meaning not working, but red means working on these ones. It's not straightforward. The problem you've got, again, lack of flexibility. When the developer put that site forward, it was assessed that they needed to provide certain things. A health centre was not one of them, for good or bad reasons, I don't know. I wasn't there at the time. So the 106 says you'll provide a site for a school.
Excuse me, sorry to interrupt. Could you provide that in an email to Councillor Chahand? Because we are limited. We've had a long meeting and we need to address it for councillors. Thank you. So next we have Councillor East.
Sorry, doing the same here. Yeah, so I'm from the Dunnington Spencer ward, and again, the 3 sites planned for a new build there, where 3,000 houses are going to be built. There were 3 schools planned, 2 of which were primary, 1 was a secondary school, and obviously the inept government has withdrawn funding for that, and it's a question of where will the all these children go, because a lot of the neighbouring schools are already at capacity, given the sort of calculations that the DFE is looking at. We're looking at 1,000 sort of primary places and about 500 secondary school places. So with the secondary school not being built, what's going to happen in that sense?
Sorry, what area are we talking about?
Darlington Spencer, so Darlington Park
Darlington, yeah, okay.
School.
Sorry, I thought you said Daventry. So Darlington, the DFE were due to fund through the DFE, as you're right in saying. We are looking at how we can fund a secondary school there, whether we're exploring whether there is enough SIL to be able to fund a secondary school, or whether we build a secondary school, as I mentioned earlier, within the Wootton area, to mitigate that demand. But there isn't anything we can do about the DFE's decision. It's just now looking at where we can create capacity elsewhere and what funds would enable that.
Okay, so what will happen to that site then that's earmarked for that secondary school?
It's still under review.
Okay.
Yeah, I wanted to ask a quick question on that. Sorry to jump in, but it's on the back of Councillor East's question. I was going to wait to the end, but yeah, it's on the back of it. Basically, yeah, I am a ward councillor in one of the neighbouring wards, and certainly the secondary school is bulging at the seams. The head teacher would say we have bulge classes that are about to get even bigger to full capacity. So really, if a school was built in Wootton, that would be more than, say, 3 miles away from Darlington. That would be at a cost for the council. You mentioned obviously wanting to put schools within 3 miles, particularly secondary schools, but anything over 3 miles would incur costs, bus passes for children. How would we go around that, please?
So there are a number of things that we're looking at for secondary provision, because we know that's a real pressure point in Northampton Town. So one of those is looking at a possible smaller all through in the Wootton area. And what tends to happen is parental preferences then tend to shift, because you've got a lot of movement within Northampton Town, and where parents are sending their children away to further away schools. And so putting on another school doesn't mean that it's just going to take children from that area. It frees up capacity at other schools, if that makes sense. So you get a shift in in movement, which doesn't necessarily impact on transport costs. In addition, we have some funds that we're waiting to release from developers that are currently in dispute that should be enough to permanently expand one of the secondary schools in the Duston area. And then we're looking at plans for our other oversubscribed schools, because the aim is to ensure, or try to ensure, that we're meeting higher numbers of parental preferences and we're increasing access to good and outstanding education. So that will all be part of the school organisation plan, and using the money that we have access to be able to create more places where we need them.
Thank you, Shazia. Next is Councillor Heron.
Thank you. Can I just say that you mentioned, I believe you meant to say Chenderrit, which is the secondary school. You've got it down here as Chenderrit Primary School, and there is no such thing. It is Middleton Cheney Primary School. I mean, it is a feeder into Chenderrit, but it is actually Middleton Cheney Primary School. And Middleton Cheney are getting a lot of development. There's another 165 houses going there now. That planning application's just going through. They've had a big expansion down Waters Lane, and the primary school, which is already it's already a two-form intake. Constituents have been concerned that it's having difficulty with parents who come across the border from Banbury, and that they're having to try and limit that, which means that they're not going to be able to be with their siblings, etc. So I just wonder how much cooperation you're doing actually with cross-border, where you've got such as Middleton Cheney and Chenderrit serving both Banbury and the local area.
Sorry, in terms of Chenderrit, that's the Chenderrit. It's the name of the planning area, and not the school. So we have names given to planning areas, but I haven't named individual schools within this presentation. So I don't know if that was.
Well, it just says Chenderrit Primary.
Yeah,
it says Chenderrit Primary School, and it isn't right.
Yeah.
Okay,
planning area
you.
for primary age children that does often include multiple schools. It's just a name for that planning area. It's not a misname for the school at all.
Okay.
And just very quickly on the school admissions, each school has an admissions policy, and that admissions policy usually prioritises local children and siblings. If there are places remaining after those criterions have been fulfilled, then children further away can secure a place. But usually, if an area becomes more saturated in terms of families, those who are across the border usually then are less likely to secure a place.
Yeah, and I think that's what they're concerned about, because obviously they've got families have made a commitment to be going to that area. They've got older children in the secondary school, etc., and now can't get the rest of the family into the primary school, so it's causing difficulty.
Can I just quickly respond to that point from Councillor Herring? Shazia mentioned that we return our numbers to the Department for Education every year. They look at cross-border movement all the time. What we cannot do, and schools cannot do, is say, you're only allowed to come to our school if you live in West Northants. You're not allowed to do that, rightfully so, I think. But Shazia is absolutely right. Distance is usually the deciding factor on the allocation of school places. So if there are lots of children that live closer, they will get a place more than people coming across border. But we do take all of that consideration into account when we do look just beyond the border, not just obviously down in the south, but other borders that we have as well.
Okay, thank you. We're going to move on to Councillor Aldridge, then Councillor Baker, then Councillor Owens. Okay.
Councillor Chauhan has covered the all-through schools question that I had, but I just wonder whether I could pick up on some of our conversations from earlier around SEND and looking at provision, any kind of resource-based provision in some of the schools that are being thought about in terms of development, because this strategic planning is so critical, and we know that we've still got challenges around SEND. So how are you taking all of that into account as you start to shape the future plans for schools?
If I just come in on the SEND contribution, and then I'll pass over to Ben to talk about this delivery. So within our section 106 contributions, we now request a SEND amount for every planning application that comes forward. So we ask for 4 times the amount of money for a mainstream place. So a mainstream place costs roughly 30,000. We're asking for about 120,000 for each SEND place, because we know the number of children per 1,000 homes who will require a specialist place. And that's fairly new. So once those planning applications come forward, we'll be using that section 106 to deliver more specialist places. But I'll pass over to Ben for some of the detail.
There's 2 quick bits I'd like to reply to, if that's okay. First one, all through schools, I get it, I'm up for that conversation. There's no evidence in the world it improves outcomes for children. There is no evidence at all. And every decision that we make should be founded in, is this going to support improving outcomes for children? So I think there are pros and cons. We never rule anything out. We'll never just rule anything in completely. In terms of our resource basis, inclusion units, whatever language we want to use, specialist units within mainstream, we already have a number of units. The leaders of all of those units across primary, secondary are coming together as a group now who have that expertise, who lead those units in particular. They will have an influence on the design of our future units, as will Kim and other parents, as will our young people. And we've made a commitment to our young people with additional needs. They will all have a role in shaping what those units look like in future. There is not one size that fits all. I know you know that. But that is definitely going to be part of the future. And that is one of the most exciting bits for me, designing schools with those really inclusive bases that are not internally exclusions, that are genuinely about building and including every single pupil in that school.
I was undecided what to ask you, because obviously I've spent a lot of time studying this in my lifetime. But I always ask quick questions. So first of all, I'm very interested to know where you're going to expand Spon School into. If anybody knows that, that will be a miracle. And what are the secondary school elements for Chenderick area and Brackley area? You've got 2 at the moment, schools, and there is an overcapacity that's going to come forward. You're basing this on planning applications that are known and going in the pipeline, but I have seen 2 more planning applications for another 1,750 houses with a secondary school tacked right on the top, probably in House Village. So are you aware of that application? And what I've told them, first of all, they can't put it there. That's ridiculous. It's right on the top of a mountain, like it's 2 miles from Hulse. That can't be there. It's got to be down the bottom, but that's another question. The other thing I wanted to ask was a bit about the SEND. No, I must tell you, first of all, I believe there is a case for all through schools, basically because we do know with our children that the difficulties that we have with many, many children when they convert from primary into secondary, that's when they all fall off the cliff. So therefore, there is a plus for an all through school. The real question I wanted to ask at the beginning, before I added all the extras, so I apologise, was actually, I've read the white paper, but that needs to be read about 20 times to understand it, and I'm looking forward to your presentation. But is there any element in there that says about classroom sizes? Because I would imagine that if we're going to ordinarily incorporate children into classes, the number of children we have in a class at the moment will be too many, in order to accommodate all of the the children that can be accommodated in a normal classroom. So is there any numbers? I know it's 30 and we stretch it to 32.
Councillor Baker, at the moment there is no detail in the white paper, no proposals around reducing class sizes. I think one of the angles in which that will be looked at is the way that we design buildings. So rather than the number of children we put in rooms, it's more likely to be the square meterage and the way that we use the buildings that we have. At the moment, there's nothing in the white paper that says we're going to reduce class sizes. At the moment, so I understand the question. It's a good question.
Thank you.
And Councillor Baker, just in terms of the response to the first part of the question, what you've been presented with today is a draft school organisation plan. We cannot finalise it till we know what's going in the local plan. It will be updated, and then what it will become is an evolving picture, because obviously every year we get new birth rate information, every year we get new demographic information. So it's designed to be updated. The way it's been written is the right methodologies are in the background, we can add numbers in and it will continue. So it's not fixed yet. So if those new developments and the school on the top of the hill come forward, they will obviously be factored in.
Okay. Tony Owens.
Yeah, thank you, Madam Chair. My question, I don't know if you can answer this question either. I'm not an expert in strategic planning, particularly for schools. It's just not my area of understanding. When you plan out these schools, do you look at kind of like the whole holistic view of these things? So, for example, what is the ability for medical services to respond to these schools in a certain time frame? We have a rising counter-terrorism threat in this country, and obviously schools would be a prime area for attack. What do we talk to the police? Do we talk to the other health services? Do we talk about what time, what the response times would be to these? Where our nearest, counter-terrorism units, firearms officers are? What's their ability? Is that all done in the initial planning, or is it not? My second part would be to Councillor Jahan. I would second your point. I think it's valid. If it's not used for a school, definitely GP surgeries is absolutely what we need. I've been barking on about this since I came into council. We're losing surgeries, one a week nationally. We have 2 surgeries in Northampton currently in special measures looking to be closed down. We need more GP surgeries, absolutely. But a building is nothing without the staff. And we can't get the staff to recruit into GP surgery, so there's no point in just an empty building sitting there if there's no staff to be in them.
Sorry, Councillor Owens.
Thank you.
Can I just interrupt? We need to keep this, whilst I appreciate that GP surgeries are important, could the officers maybe email you about that and we keep to schools? I do appreciate that GP surgeries are crucial and other things in the community though.
Chair, sorry, I just want to comment on that very quickly. The point is that we need everyone to work together, regardless. Yes. The issue we're seeing constantly, and I think I brought this up in adults as well, is we're all working in silos. So when it does come to planning and, like Ben just mentioned, planning and, schools and everyone, we're working together. So it's important to bring that up because of that, not to labour the point too much. Thank you.
Thank you. James.
Chair, I'm happy to provide a really quick response to that question because I think it's a really good question. Be honest, I'd never thought of joining things up with the police and thinking around counter-terrorism around schools. That makes me shiver, but we need to do it. So I absolutely accept. Yes, we share all of our planning information around new schools with health services. Yes, where we can co-locate, where we can co-design, etc., etc. So Tiffield was a good example of that, new special school, and we will continue to do that. That's not GP, that's more around those primary support that we can put into schools. Yes, we do that join up. Yes, there could be further join up with other public services thinking around emergency services as well. I'm happy to pull that into the future planning, definitely.
Yeah, thank you, Chair. I mean, I'm very conscious here of straying into areas in which I'm not expert, but it did seem that the committee was advised during discussion that some of the applications and the associated Section 106 agreements that are coming forward now were set in the past, and the council is therefore bound by the decisions taken then. And there's a distinction between that and the approach and the agreements being sought now, which include more flexibility, certainly around the difference between using contributions for education provision and being prescriptive about where that education provision is located. So I think, yeah, it was highlighted during discussion that some of the things the council is required to do now, it's required to do because of agreements made in the past.
So are we happy as a committee to note that report as it's in draft? Thank you. Okay, we move on to item 8, which is our One West Northamptonshire plan, and over to you, James.
Thank you, Chair. So I'm certainly not going to speak about the performance position reflected in the report, but to give the committee some context about why this is on the agenda. So this was an outcome from the triangulation group meeting at the start of March. Up until now, we've had a situation where the One West Northamptonshire Plan performance report, which is essentially a corporate quarterly performance report on the council that goes to the Cabinet, that has been, up until now, presented to the Place and Resources Overview and Scrutiny Committee, which is the corporate scrutiny committee, in inverted commas, the one that looks at the council's corporate functions. That produced an unsatisfactory position where the report was presented to the Place and Resources Scrutiny Committee. It was presented by officers whose speciality was in corporate performance, and there was a tendency for the members of that committee to want to ask questions about performance relating to adult social care, children's services, things that were outside the remit of the Place and Resources Scrutiny Committee, and the relevant officers and indeed cabinet members were not at that committee to answer the questions raised, which produced a frustrating and unsatisfactory position for all concerned. So the triangulation group has now taken the decision that it would be logical and more effective for this quarterly performance report to be included on the agenda for each of the 3 scrutiny committees in future, not just the Place and Resources Overview and Scrutiny Committee. The timing of the triangulation meeting and that decision enabled it to be just placed on the agenda for the Scrutiny Committee meeting today. I think it's obviously open to the committee, as far as you wish to do so, to get into questions, scrutiny, challenge about the reported performance within this committee's remit at the meeting tonight. Whether you may also, though, wish to consider how the committee deals with this report in future, because there are practical questions there about, for example, would it be effective for committee members to identify questions they want to raise arising from the corporate performance report in advance of the meeting to assist you in getting the right people attending the meeting who could then answer the questions. So it's brought to you tonight with the intention that it should be the first example of this report being brought to the committee on a quarterly basis in future. However, I think there is also scope there for the committee to think that may be something that you discuss tonight, or it may be something that you take away and think about and informs how we go in future about how the committee deals with this report in future. So that's just hopefully some useful context for you about where this has come from and things you might need to think about in dealing with it in future. You could also make the argument that a lot of what the committee has done tonight already, for example, in relation to SEND, is about performance in broad terms rather than it needing to be hung on this report.
Councillor Owens.
Yeah, thank you, James. I would agree with you. I think it's something that we should have presented to us before the next quarterly meeting so that we can raise the appropriate questions if need so. I would recommend that if the other councillors are in agreement, if that could be seconded.
I'll second that.
So I think, I think what you would be looking at is obviously the agenda papers for the committee meeting are published 5 working days in advance of the meeting. That would give you a window for members to say, on this example of the quarterly performance report, I think the committee should scrutinise X, Y and Z. That enables us to get the relevant officers to deal with X, Y and Z to attend the meeting. I mean, clearly, some of those, the Director of Children's Services is the leading example, are likely to be at the meeting anyway. But particularly perhaps with this committee, where its remit is not only the children's side, but also the housing side. For example, we haven't got Jane Carr as the Director responsible for housing present tonight because there's nothing else to do with housing on the agenda. If the committee wanted to pick up points to do with the housing performance, then we would need to ensure that she or one of her heads of service or assistant directors was present. So sorry, I'm conscious that again, that was a rather long-winded answer to say, when this appears on the agenda, you'll see the agenda papers 5 working days in advance. That gives you the opportunity to say, at the meeting, I think the committee we should discuss these areas.
Councillor Aldridge.
Yeah, could I suggest that priority 4 and priority 5 are the 2 areas that this committee has in mind in terms of its focus, and then any other areas could then be brought up if particular members of the committee want further information or want to explore it further, because I think for us to be deciding at each meeting or for each meeting which officers to have present and so on, the obvious ones for me are priority 5, which is best place to grow up, and then more and better quality homes, because this committee is also to do with housing. So those are probably our priorities, and the other areas are obviously important as well, and they impact on those 2 priorities that I've mentioned. But I just wonder whether we could kind of pay attention to those 2 priorities in particular at this committee.
Chair? Yeah. Oh yes, I mean what Councillor Aldridge has highlighted are absolutely the areas that relate to the committee's remit. I think what there is the opportunity for the committee to do, though, is to focus in within those areas. And so one way of dealing with this report would be to have the relevant cabinet member or the relevant director attend the meeting and say, here's the report, here are the areas that relate to this committee's remit, here's a bit of a summary on how we're doing on each of the indicators within those areas. A more focused, more effective way of proceeding might perhaps be to put the onus on committee members. So the agenda papers are published, you see the corporate parent, you see the corporate performance report. There's then an opportunity for councillors to say, at this meeting, I would like to ask a question, I would like to know more, I would like to challenge about this KPI within priority 5 or within the other priority. And if there's nothing that the committee wants to focus in on, then fine, the report can just be noted. But that is about that may be a way of focusing the committee's time on to best effect. I'll put that out there to see if you agree or don't.
Do we agree? Do we agree?
You've got speakers.
Okay. Councillor Baker and then Councillor Hevin.
I just wanted to bring up one specific thing now, because we are looking at specifics, I think, not the whole area. We've found tonight that it's really time-consuming to look at the whole area, as we've done with SEND this evening. It takes a whole evening, doesn't it? But we have, for example, you were talking about housing. There is a large amount of money in housing for building children's homes, which would actually really have a big effect on the Children's Trust budget. That money has been sitting there for some time. I would actually like to hear from the director in the housing department, Jane Carr, exactly what's happening about that money. Why haven't you found somewhere to spend it so that we can put children in homes that belong to us and not pay hedge fund managers?
Good points. Councillor Heving.
It doesn't exactly fall easily. I know priority 4 and 5 are roughly the right area, but for instance, I wouldn't have thought it's for us to be monitoring the performance of the planning department, which is in priority 4. And there's a department that produces all of this data, isn't there? And a team, yeah. And one of the things that worries me, I mean, we could try and go round in red and say, yeah, that falls into this area. But I wonder sometimes whether we're looking at the right things and whether the KPIs are actually the sort of things that we should be actually recording. And I think it's a bigger topic, actually. And I'd be interested to know how you thought we could do it, but maybe a workshop with the people who are actually producing this data and see whether it's actually giving us the information that we think is relevant. I think it might be worth a review.
I mean, I think that's a question that goes beyond the remit of just this committee. Yeah, again, speaking from very limited knowledge, I'm sure you're going to have a situation where there's a combination of things that the council may be required to have as key performance indicators, and some it may choose to have as key performance indicators. But yeah, I mean that may be that's possibly something that could be fed back to the triangulation group coming out of that, because that is where scrutiny comes together, and who knows, the cabinet may have a view on what goes into the performance report as well. And yeah, I mean to pick up on your earlier comments about what the committee looks at and how broad it goes, I think you could also make an argument that the committee should the committee should be using the report to do scrutiny. It is information that can help to inform your conclusions about how the council is doing something. So the scrutiny should use the corporate performance report. It shouldn't be scrutiny of the corporate performance report, if you see the point I'm trying to make.
But then if the scrutiny says these KPIs aren't actually giving us the information that we'd like to keep looking at, then yeah, I think it's worth a wider discussion with the triangulation, yeah, and actually carving out between you what you think of those KPIs this committee should be looking at, as opposed to, for instance, I don't know who will be looking at the planning performance.
I think the Corporate Performance Scrutiny Committee, which was the scrutiny committee responsible for corporate matters, as you would gather, up until the scrutiny function was reorganised for the start of this civic year. They did do a piece of work about the content of the One West Northamptonshire Plan report, which led to some changes. So yeah, it's something that affects this committee but isn't solely within the remit of this committee. So I think feeding back to the triangulation group is the right way to go. And was the committee, did the committee as a whole support Councillor Owen's point that in future, when this comes, councillors should be asked to indicate ahead of the meetings what they wanted to focus in on from within? Thank you.
Okay, well, I have no other business.
Work programme, Chair.
Oh, sorry, work programme. Yes, we need to look quickly at the work programme.
So do you want me to...
James, yeah.
Okay, so the work programme is before you at the end of the agenda pack. A couple of points to highlight. Firstly, having had the SEND update today, does the committee agree that it doesn't want that at the next meeting, given that that's about 6 weeks away?
Yes. Yeah.
Okay. And also on the subject of the next meeting on the 28th of April, at present the work programme includes probably more potential items than might be dealt with realistically at one meeting. I mean, this meeting and the previous committee meeting have been quite long. If the committee is happy with that, then fine, it's for you to say so. But otherwise, it's about taking a realistic view of what can be done. So, as things stand for the 28th of April, there is an item. There's an item listed on early years. Committee to consider early years provision and WNC's best start in life plans submission to government. There's an item on looking again at the non-school alternative provision commissioning framework, which only came to the committee last on 27th of January. And then there are various other items to be confirmed. Family help and family hubs, smartphone-free policies in schools, support for foster carers, revisiting the scrutiny review on that, empty homes, take-up of the early education and childcare entitlement in West Northamptonshire. What of all of that does the committee prioritise for doing for 28th of April?
Just a quick question on that. You know the, sorry Chair, you know the consultation on the food, but when did that come to an end? Do we know?
26th of May, I believe.
Was it 26th
Is that
of May
right
came to an
then?
end?
Are you talking about the white paper?
No, the consultation on the school's policy for phone usage under 16s.
That consultation closed at the end of January. Oh, so there is a report that will go to full council, which is a response to the motion there, which includes all the feedback from the consultation and what we're going to do next. Okay.
Councillor Baker.
I would like to see that we did the early years section and the family hubs, because I know that lots of our council members are constantly asking about when we're going to be able to expand the family hubs into other areas where they're desperately needed. So I think it would be good to look at that as well. Thank you.
As I recall from last meeting, we were going to look at early years and the response from the DfE. And also family hubs does link in to that. Yes. So the two together would be good. Councillor Owens.
Thank you, Madam Chair. I just want to clarify, because so you said the alternative provision, is that the £40 million of contracts? James?
Yeah, it was the item that was presented by Ashley Leduc on 28th.
Just because I was very unhappy with the scrutiny over the contracts and how they're going to be, actually initiated, and what's the actual kind of provision and overview of those contracts that are going to be provided. I wasn't really happy with the reply that after a year we'll look at them. So if anyone's in the second week, I would like to hear more about that again.
I mean, could that possibly be something that was dealt with by some circulation of some off-agenda information? Or is the
It certainly
public...
can be, as long as it's provided detail enough, so I understand what is the scrutiny, how are these contracts, what are the terms and conditions of these contracts, is it being tendered out appropriately, and what is going to be the length of time before the services are actually being provided, because that's my main concern. It's all well and good having contracts out to individual companies, but how do we measure and quantify whether those actual services are being provided? And what kind of stipulation in those contracts allows for a penalty should those contracts not be given?
Yeah, we'll let Melanie answer that.
Thank you, Chair. So in terms of the AP framework, or the AP item that you're talking about that went to Cabinet, it was the agreement to develop the alternative provision framework. Yeah. So all of the things that you're talking about now will be part of that framework development. So I can give you assurance around that. If you want further detail in terms of the process that we go through, for the development of a framework, then we can definitely provide that. I'm not sure if I may say so, Chair, that coming to scrutiny would necessarily be a good use of scrutiny's time, because we're developing the framework, if that makes sense. And we do have commissioning and obviously procurement regulations that we have to follow.
Yes, I was just going to say that actually from our last meeting we did hear that was 40 million over the space of 5 years, but potentially obviously not 40 million. And we also heard that it was in draft stages, so I don't feel that would be a feasible item to bring. But in saying that, there is nothing to stop us from having some information circulated from Ashley Leduc. I think we have 2 items, is it, James? Councillor Aldridge, I apologise.
Yes, I think what is really important that we remain at the sort of broader strategic level and not get caught up with too much detail of different areas of work. So I think getting an overview report on any particular area from time to time would be completely appropriate, but not to go into the minutiae detail that officers are responsible and accountable for the delivery of. I do think that early years is a key area, and I think there's a massive amount of development taking place there. So as a scrutiny committee, we certainly should have a look at that. And the development of the family hubs, because that's been talked about, and the progress again in terms of that whole critical development in West Northants. I would be really interested in a broad overview progress report, not too long, about how our youth strategy is progressing, because we did some really good work on that, and that's already in place. So some input on that would be, in broad terms, would be really helpful. Thank you.
Melanie.
Thank you. Through you, Chair. You'll be pleased to know then, in that case, I mentioned it to Councillor Baker earlier, so we've with the feedback that was made from scrutiny members and also the Youth Council, we've now updated that strategy to incorporate all of that feedback. It's going to our Youth Offer Board on Wednesday of this week for agreement, and we've asked other colleagues, partnership colleagues, to add any comments. It's then my intention to send it out to scrutiny members so that you can see the final draft, and then we're looking to take it to Cabinet either May or June time. So you will look at it and you'll see it as a new strategy, because I think all of the feedback we had was really valid. I did read the strategy on Friday, and I'm really pleased with it, whereas I will honestly say when we brought that first draft to scrutiny, it most definitely wasn't where we needed it to be. But I think you'll all be really pleased in terms of the progress. So I will share that before the next scrutiny. I hope to be able to share that in the next week or 2.
Through the Chair, if we then have a brief conversation about that at the next scrutiny group meeting.
I feel that what you've said, Melanie, would it be that we would have that that feedback maybe in some written form first?
Yeah, through you, Chair. I'll send the updated draft strategy out, as I say, in the next week or 2. Very happy to take any final comments, and then at the next scrutiny maybe we can say this is the final
we can
strategy agreed by scrutiny.
Very briefly agree on that. Yeah, so we do have three items there. We have the early years, the family hubs, and the conclusion really of our input or what we feel of the youth strategy going forward. So I think that will be substantial enough. So there is no other business, but I'll go over to James.
Sorry, just to be clear, so you would be talking about reporting the youth strategy to the next scrutiny committee meeting?
If I may, Chair, I don't if you're in agreement. I don't see the purpose of writing a report. What I would suggest is that we send the strategy out draft to members, so it won't go out as part of the agenda, and it's a discussion point, as opposed to sending out the draft strategy, because I'm mindful that it's not been approved, and I wouldn't really want that in the public domain until we've all agreed what that strategy looks like.
No.
So if it's okay, I won't write a report, it will be a discussion point.
No, it would just be a discussion, basically,
Thank you.
Basically conclusion. Thank you.
Sorry to labour the point, but it would appear on the as a separate item on the agenda for that meeting.
Okay. Right. There is no other business. So thank you all very much for what has been a long meeting yet again. Thank you. Good night.